welcome you to Alumni House today. My name is George Scharfenberger. I'm very honored to be up before you to welcome you to this symposium on global changes and global health. We have a very packed program today, some excellent speakers, but the most important part are you, the participants themselves. What we hope to come out of this, as Eva will explain in a second, is some excellent collective cooperative thinking among the Berkeley community to move beyond thinking about what the problems are towards what are we going to do to be part of the solution. So we look forward to that. Before I introduce our welcoming speaker, Graham Fleming, the Vice Chancellor for Research here at Berkeley, I'd like to take a minute to thank the sponsors of this symposium, the Center for the group within the Berkeley Alliance for Global Health, the Center for Global Public Health, the Henry Wheeler Center for Emerging and Neglected Diseases, the Bixby Center for Population Health and Sustainability, the Center for Global Metropolitan Studies, and the Berkeley Water Center. I'd also like to particularly give credit at this point to two individuals who have had a particular role in pulling this all together. Kirk Smith, who will be joining us in a little while, and Eva Harris, who have been the kind of the brain parents, or if we're the brainchild, they're the brain parents, I guess, behind this process, and without whose energy and excitement and drive it probably would never have happened. So we want to thank you all very much. So let me introduce then Graham Fleming. Professor Fleming, as many of you know, has recently taken over as the new Vice Chancellor for Research here at UC Berkeley. He was the Berkeley Labs Deputy Director from 2005 to 2007, and through joint appointments as the Melvin Calvin Distinguished Professor of Chemistry at UC Berkeley and the Founding Director of Berkeley Labs Physical Biosciences Division and UC Berkeley's California Institute for Quantitative Bioscience, also known as QB3. He has really shaped the intersection of physical and biological sciences. And very much what this meeting is about is the intersections of all kinds of social, physical, and biological sciences. He is a highly active and successful researcher. I won't begin to try to describe the things he has worked on, but most significantly for our meeting today, it's important to note that he's been one of the leading speakers and thinkers on the interrelationship and intercomplexity of energy, climate, and photosynthesis. So, Professor Fleming.
Thank you, George, and it's my pleasure to welcome you here today. I think it's the social and probably moral responsibility of public universities to address the major issues that we see in the world. And in our Chancellor's phrase, this institution, being committed to comprehensive excellence, has the potential to really have an impact on the major issues confronting our world. As recent events have amply demonstrated, these issues and events are truly global in nature, whether it's H1N1 or the global financial crisis. Superimposed, however, on rapid events like the financial meltdown or the flu outbreak, there are long-term trends in climate and demographics. These have enormous implications for health, from the outbreak of new diseases where our traditional approach of one pill for one disease will be completely inappropriate on any time scale that's relevant. Coupled with massive shifts in population as a result of drought or global economic change. Understanding and responding to these challenges requires work in many disciplines. It requires educating new generations of students in new ways and in mobilizing and partnering with organizations and resources that can work on the scale appropriate to the task, that is, globally. These aspects of the problems that you'll be discussing today are actually quite common in all of the major concerns. In the area of energy, which George referred to earlier, without the integration of social science, law, business, and economics, all of our engineering and chemistry, physics, and bioscience won't amount to much. We really have to use the resources of our university and not think that we can look within our own disciplines to solutions to these problems. I think that's what's so great about the process that you began with Kirk and Eva, I gather a year ago, to begin conversations on how to create this initiative with faculty from a wide variety of disciplines on the campus. I really want to applaud this process and hope that we'll see many more such efforts on our campus as we define what are the great works of the 21st century and what should Berkeley's role be in working towards solutions to them. I want to therefore wish you every success in this endeavor and get the meeting started. Let me just say that I need to apologize for one thing. I'm going to run out of here because I double booked myself this morning and my next engagement is in Stanford and it was at 10 o'clock. I've moved it a little bit, not owning a helicopter, but I'm going to have to run. So this is a great thing to do, and please be assured that if my office can help facilitate this process as it develops and builds, we'd be not merely happy, but thrilled to do so.
I want to again thank Graham for joining us and providing that very, in some ways, challenging opening. I also want to recognize the degree to which he represents the best of Berkeley, not only in his scientific productivity and commitment, but also in his willingness to go to the junior college down the peninsula and impart some of our wisdom to them. So I really want to thank you for that social mission. I would like to then turn it over to Eva Harris for a very brief discussion or presentation of what this is all about, because it's somewhat different than many of the other symposia you may have attended. And again, for the few of you in the audience who don't know Eva, she's a professor of infectious disease, president of the Sustainable, I can't remember anything, Sciences Institute, and faculty director of the Center for Global Public Health. Eva.
Thank you very much. It's really lovely to see you all here this morning. And what I was going to do is give you a brief history of where this came from and also introduce you to some of the centers that are behind this symposium and kind of where the thinking came from, because it is rather unusual and we are at a very important stage, which is essentially the coming together of ideas and launching of this new idea. So what I wanted to tell you about is the Berkeley Alliance for Global Health, which was actually launched almost to the day 1 year ago. And this is one of the research endeavors and kind of flagship programs that is within the Berkeley Alliance for Global Health. And so first, let me tell you about this. And we're very excited to have such an entity which is on campus, which really is a synergy between and a connection of the Henry Wheeler Center for Emerging and Neglected Diseases and the Center for Global Public Health. And as you'll see, what we've been doing is coalescing all of the energy and the existing commitments and research that is ongoing on this campus around science and global health. And as you'll see, it goes to engineering and then law and then business. And there's so much activity going on, but it was very disparate. And so what the point was initially, that in parallel, the Center for Emerging and Neglected Diseases pulled together what we call essentially the upstream part of the campus, biological, chemical, physical sciences. And we at the Center for Global Public Health were pulling together essentially the downstream elements, although many of us actually are also molecular biologists and kind of span the spectrum. But the idea was to kind of pull together all of what's going on into one place. And now we're actually expanding from that to the rest of the campus. And this is what's so exciting about this new symposium, which is really launching a new program. And so the idea is that is essentially we have so much wealth on this campus, but we want to take it from discovery to delivery, and then also from the bench to the community. And so that's kind of what both of these centers, and we essentially say the Berkeley Alliance for Global Health, coming from the essentially discovery in the bench to application in the field, and the science all the way through. Always focused again on solutions. And so we have about 80 faculty, several hundred participants in terms of all of the different people on campus involved in many colleges and professional schools. And so but I want to show you a little bit is how much is going on. I wonder if is there a way to dim this one light by any chance? Or is it, I have no idea, but you just will be able to see a little bit better. And then, and programs to train the next generation, because of course through all of this is research and education, because naturally being a university, education is our mission, as well as service, and this is something that we bring in all of our programs. This is just showing you in the world, the picture of the globe, where all of some of the projects are that UC Berkeley faculty are already involved in. And so there's about 25 countries, and I'm going to show you here is just in the Center for Global Public Health, some of the types of projects. I personally work in Nicaragua on dengue, there's Costa Rica, there's a big mortality disabilities project, Guatemala, childhood pneumonia, and respiratory illnesses in Argentina, arsenic. There's a number of TB. This is some of Lee's projects, who you'll hear from later. Essentially we're looking at infectious diseases. There's a big water project in Bolivia. We're going now to Afghanistan, where there's postpartum hemorrhage prevention, so childhood mortality, maternal mortality. China, schistosomiasis. We also have air pollution work going on there. India, HIV, chikungunya, TB. So there's essentially what you're seeing is many different places. Again, this maternal mortality in Ethiopia, STD prevention, HIV in Zimbabwe, Nigeria as well. And so there's a lot of different projects that are spanning the globe, but also spanning many different types of studies, from infectious diseases to maternal health to air pollution. And this is just within the Center for Global Public Health, and we only put up a couple of them. So once we started seeing that, we actually realized that we have this incredible resource here, which is not only what's going on this campus, but what's going on in the field. And I think this is particularly important because the concept of global health is something that the term was coined relatively recently and has become very trendy. But in fact, all of those projects have been going on between 10 and 30 years. So our faculty have actually been committed to global health way before essentially the rest of at least this country, et cetera, woke up to the fact. And so, and through that, very importantly, have established really long-lasting relationships of trust with their colleagues and also with the government and other really important players. And so we're really set up to do important work, not only in the research, but also in the solutions and the rolling out, importantly, the rolling out of pilot solutions, precisely because of that commitment of Berkeley faculty and students over the years. So I'm missing some of these arrows that fell off in the computer land somewhere. But the alliance, the point here is that we're really combining epidemiology, disease prophylaxis, diagnosis, therapeutics, immunology, and the part of essentially from the science aspects now. But now we can move into field research, economics, policy and law, business. And that's kind of where this symposium is going, is taking it further beyond what we have to the rest of the schools on campus, which traditionally have been not necessarily thought of within the narrow confines of global health, but are absolutely essential to that. So that's a little bit in the background of just what are the centers that are behind this. And then, of course, we also have other sponsors of this symposium. But now, thinking about this actual research project and the symposium concept, I mentioned that there's been a huge amount of global health activity for many, many years, and actually decades on this campus. And there's also an increased momentum towards interdisciplinary approaches, essentially recognizing the complexity of our world and of health problems, and that essentially, this is an unprecedented moment of global change. I think everyone always feels that their moment in history is unprecedented, but nonetheless, unprecedented moment of global change. And what's really important is that we're coming to the conclusion that we can't look at health as just health, and okay, we have one disease, and here is how we treat that one disease, because in fact, it's what's around it, the social, cultural, political environment is utterly crucial. And also the drivers like climate change and economic globalization and demographic change and migration are some of, but are very important drivers that influence health, but also that issues in health influence them. And I'm going to give you, for instance, the swine flu is a really perfect example, because it's clearly a health problem, but really, where is it coming from? There's obviously issues of migration and demographic change, but there's a really interesting article in yesterday's Sunday New York Times. Yesterday was some other day. What was it? I don't even know what it was. Thursday. I've been I've been sleeping for like the last week and some, but it being Thursday, in the business section, there's a really interesting article on Smithfield Farms, which is this huge pig meat packing industry, and it's essentially complete takeover of Eastern Europe and Romania, and there's atrocious conditions, which actually led to swine flu epidemic several years ago in Romania. And there have been a number of articles in the press about the same Smithfield Farms, which actually has an enormous pig packing or matanza, I guess they're called, slaughterhouse, right outside La Gloria, which is where the first case of swine flu occurred in Mexico. And they actually were in such violation of U.S. regulations that they essentially moved from North Carolina to Mexico and Romania, where there's less regulations. And so, and they've actually had epidemics of swine flu. So that's two and two together. Now, so obviously, this whole issue of economic globalization is now having a direct impact on health. But now we look at health and how that impacts economics. I mean, essentially, this has been disastrous for the economic of Mexico, for one. And so there's going to be all kinds of consequences because of the further collapse of the Mexican economy, which will then lead to migration back. And in fact, in this article in the New York Times talking about the Romania situation, it actually was affecting not only Romanian pig farmers, but actually in Africa. Like in Abidjan, there's a quote from a pig farmer, essentially that there's 90% of the pig farmers in that region, as well as in Romania, have now gone out of business because these huge, meat packers have come in and reduced the price of pork. And so now those people, the quote was from this guy in Abidjan, looking, having, well, now that I have my passport, I'm going to migrate, because there's nothing for me to do here. So clearly, all of this is terribly interconnected, and it all actually impacts on health. And so the whole point of this conference was to say, we at the School of Public Health, or we in molecular biology, or we in the law school, we're all working on these pieces, but it's really complex, and oftentimes it's like, oh my gosh, this is too much to think about. But we said, you know what? Let's do it. Like, we can do this on this campus precisely because we have all of these schools and people, and precisely because the faculty are interested in this common theme. So last May, we started a group that got together from incredibly disparate departments and schools, and it was just this incredible energy and synergy that happened in that room, and we just said, okay, let's just continue brainstorming. And so we've been brainstorming with faculty to essentially leverage not only the multidisciplinary aspect, but also the strength, of course, of the faculty here, and how we can actually address certain health risks with this larger view. And so the idea is that we have a methodology, actually, that Wayne Getz, who will be a moderator from at lunchtime, actually essentially came up with a framework that we can start looking at this kind of methodologically, where we're, in terms of diagnosing the problem, analyzing the drivers, which in this case we're first focusing on climate change, economic globalization, and demographic migration, and then address the health consequences, and most importantly, catalyze solutions. Because many of us here are actually not only involved in the research, but actually are in the field, rolling out pilots and actually collaborating with many governments and countries to actually make those pilots happen to health policy. And so we have the perfect, essentially, opportunity as well as experience to not only think of solutions, but to actually catalyze them and make them happen. And so that's really what we're about here. When I say multidisciplinary, this is just a list of some of the schools and different elements of campus that have been actually regularly coming to meetings to brainstorm this idea. And as you can see, there's an incredible cross-section of the different elements on campus, from engineering, public health, to molecular and cell biology, to the Health Initiative of the Americas, to the Blum Center, water group. And so there's essentially a huge amount of different input, but all bringing their analyses to a similar problem. And what we decided was that we were going to essentially build a multi-year, multidisciplinary, solution-focused project that would incorporate what we all do as part of being here on this campus, which is research, education, public information, policy, and action. And so that is the concept. So then it was like, well, this is great. Now what's it going to be? What's it? And so we decided that what we were going to do is to essentially start with a symposium, and what we chose to begin with was a focus on urbanization. And so that's where we have, our speakers today are going to actually address this idea of the different, essentially, drivers on health looking in an urban context, which of course is, a huge problem and opportunity in the 21st century. And so the idea is to define opportunities and to form research teams across campus to come up with white papers and ideally find interest on funders. And so what we wanted to do is to kind of bring together the campus community broader than the set of faculty that had been meeting, and also extend beyond the campus to alumni, and to students, to funders, to whoever would be interested in this new approach. And why the urban focus? Well, because first, more than half of humanity lives in urban environments, and there's huge challenges, and as we were thinking, really there's many opportunities that really occur as well. But for urban planners, public health practitioners, there's a lot of actually capacity and commitments already on this campus to a number of different endeavors in the urban sphere, including global metropolitan studies and a number of different areas. And the idea, again, is to really have this kind of, be able to have a solutions and approach, but that's actually more concrete and actually takes on specific partners with our colleagues. So the design for the symposium is that we're going to have a morning session which are going to address these drivers and their consequences, starting with the State of Urban Health by Trevor Hancock, who we're really pleased has come to join us from British Columbia, Canada. Then looking at climate change and health by Stephen Schneider from Stanford. And then looking at demographic shifts in health, Alex Eze, who's come all the way from Nairobi to join us, and we're really thrilled about that. After that, this is really a participatory symposium, and so what we're going to have is a lunchtime discussion that's going to be moderated by Wayne Getz, when what we really want is your thoughts on this, because really this is the launch of this, and so whatever comes out of this symposium and your ideas actually are going to be part of this new research program and education program. And so we want your ideas, your thoughts, your reflections, and especially your knowledge of any solutions and pilot projects that are going on that actually might be able to feed into this. So this is really important. We're trying to tap your knowledge, share with you what we've been thinking, but hear from you what you're thinking. And then we're going to essentially merge that with our afternoon session, which is going to have 3 interdisciplinary panels where we have people from, again, all of these different schools and entities on campus that are going to talk. One is going to be on risks, essentially on about urban environmental hazards. Then we actually shifted last week our disease panel, which is going to focus on a number of different aspects of swine flu. This environmental risk will be moderated by Kirk Smith. And then Lee Riley will moderate the one. And swine flu, we're going to be looking at really, how these different elements and lenses impact this one health example, and what are UC Berkeley faculty doing, and what are solutions to this, both domestically and internationally. And then look at another really important area, which is vulnerabilities. And that's going to be moderated by Ndola Prada, and looking at kind of all of the issues for access to medicines and health services, health justice, et cetera. And again, we're going to have time for you to then interact with the panel around those issues. And lastly, I just wanted to mention the co-sponsors, and a couple people I really do want to thank. This absolutely would not have come together without Miriam Rafiq, who's the coordinator of the Center for Global Public Health and has done an incredible job, almost single-handedly pulling this together, especially over the last couple of weeks when everyone was busy writing grants. And Aviva and Tamina Madan from SEND, and especially Paige Fasano and Malcolm Potts and Martha Campbell from the Bixby Center, and then our other sponsors, the Center for Global Metropolitan Studies and Berkeley Water Center. So with that, I'm going to stop and hope to have given you a little bit of a framework that will launch the rest of the day. Thank you.
Thank you, Eva. If we manage to duplicate or retain even a half of that energy, I think we'll have an exhausting but productive day. As Eva said, we have three very exciting, distinguished keynote speakers to set us off. We decided to bring folks from the outside to give some broader perspectives, and we're very happy that we were able to find such distinguished people to look at these issues from several different perspectives to really kind of give us all a common understanding of where we start our discussion. The first of these is Dr. Trevor Hancock. Dr. Trevor Hancock is a public health physician and health promotion consultant. He's working currently for the Ministry of Health of British Columbia in particular. His interests are on the health implications of policy policies in non-health fields. One of the things that I've certainly learned along this process is the degree to which non-health issues have tremendous health consequences, and I'm sure we'll hear a bit more about that. In his consulting work, Trevor has worked for municipal, provincial, state, national governments, as well as the World Health Organization. He's currently a member of the Knowledge Network on Urban Settlements for the World Health Organization and their Commission on Social Determinants of Health, and is a member of the newly established Global Research Network on Urban Health Equity. He is actually coming home to Berkeley. We're very happy to provide this opportunity to bring you back. In 1986, he was a visiting scholar at the School of Public Health, and he'll talk a little bit about that and the work he did with Len Dole, which was really some of the first work on the whole concept of what's called now healthy cities. So we look forward to hearing that. He was also a Regents Lecturer. He gave the Regents Lecture in the School of Public Health in the year 2000, evidently right in this room. So this really is a homecoming for Trevor. Thank you very much for coming, and we look forward to hearing what you have to say.
Now it will go. Good. So this goes this way. This goes back, and this is a pointer.
Thank you. Good morning. It really is a pleasure to be here. It was lovely I stayed at the Women's Faculty Club last night, and walking down through this campus is always glorious. And it brings back many happy memories. And as George said, I worked very closely with Len Dole, and Len would have loved to have been here. This is his kind of show, and he'd have been sitting over there in the corner doodling away on his pad and creating new ideas as he went. But sadly, that brilliant mind is somewhat clouded these days, and he can't be here, although I'm going to have lunch with him tomorrow, and I'll certainly tell him about this. But I just want to remind all of you about Len's work and how prescient he was. This is a book that I came across in my graduate studies, The Urban Condition, that Len edited in 1963. And he was talking in here about complexity and ecological approaches to cities and all kinds of stuff that we thought we discovered in the 1980s. And I discovered Len, and so I was really excited 25 years ago now to bring him to Toronto to speak at the first conference that we ever had on healthy public policy, this whole idea of, as George said, how health is determined really by all these things that are beyond healthcare, which in fact was the name of the conference, Beyond Healthcare. And Len's presentation there led to Ilona Kickbush's interest in the idea of healthy cities. And so, as George said, 23 years ago now, I spent 6 weeks here as a visiting scholar working with Len, and we co-authored the original background paper on healthy cities. So, sorry, that's a little tough. It's sad, it's too. But what I'd like to suggest is that you think about Len, and that as you develop this program, maybe you want to think about the Len Dual program or the Len Dual Center. So, excuse me. Okay. The title says it all, in a sense. Just out of interest, how many people in this room are from either political science or public administration? Oh, good. That's a start. There's 3 or 4 of you. Because, to me, that's the essence of this. It's not what, but how. I think we've known the what for a long time. When I was asked to speak, this drove me back to my roots, in a sense, and I went back and I hauled out my copy of Blueprint for Survival, written by the editors of The Ecologist in 1972. I pulled out Only One Earth by Barbara Board and René Dubos, 1972. I couldn't find my copy, but I also thought of The Limits to Growth, 1972. There is nothing that we're dealing with today that was not addressed then, and that's what, 37 years ago? So I don't think that we've understood better the ideas and the challenges, but I don't think that they're different substantially from what they were then. So, and even then, not only did we know what the problems were, but largely we knew what we had to do about them. We haven't, and I'll come to that point later, done very much about them. And so the question to me is not what we have to do. I think we've known that for a very long time. The question is, why aren't we doing what we have to do, and how do we do that? So that's why, for me, political science, community development, public administration, all of that, it's about how do you make change happen, not about what is the change we need. And hence this interest of mine in healthy urban governance. Now I'm going to bang through a lot of slides in a hurry, so bear with me. I'm not really going to talk much about the cities of the world. I'm just going to very briefly touch on that. I am going to spend some time on global change and health, which is bigger than climate change. Climate change is just one of a number of significant global environmental changes that have health impacts. I'm very briefly going to touch on sea level rise in cities. I want to talk about healthy urban governance, and then I want to talk about this notion of managing decline, which I first started thinking about in the early 1990s, and I haven't really pursued very much, but I think it may be relevant. Not a cheery topic, but as a health futurist, I've often worked with scenarios of the future. One of the plausible future scenarios has always been decline and collapse. It's always the one that no one wants to talk about. But that doesn't make it less plausible. It is as plausible as, and maybe in some ways more plausible than many of the other future scenarios we work with. And we like the happy ones, and we don't like to face this one, but we need to think about this very seriously, in my view, and I'll talk more about that. And then I want to end with what Berkeley can do. And there is a handout at the back, which I'll come to in a minute. So, cities of the world, just very briefly, this is from the most recent State of the World Cities report from UN Habitat. Just to point out, and I'm not sure how well that's coming over, but the point of this slide, in any case, is that, yes, there are mega cities, but the largest share of the population are living in these smaller cities, smaller than the 1 to 5 million, which is the brown bar is 10 million plus. The next bar down is 5 to 10 million, and then after that it goes down below 5 million. And that's where most people are. So it's smaller cities, not the mega cities. And this slide makes the same point, which it looked better on my screen than it does on this, that again, most of the growth in terms of the numbers of new cities are not really the really big cities. It's the medium and small size cities that we have to work with that a lot. There's a lot of them, and there's a lot of people living in them. And so the challenge is we tend to get, I think, subsumed by our interest in these mega cities, but it's really all these other smaller cities where most of the people live and where there's a huge amount of work to be done. Global change and health. About 15 years ago now, maybe 20 now, Kate Davies, a colleague of mine in Canada, and I did a report for the Royal Society of Canada for their global change program. And we were asked to look at global change and health. And we identified, I guess it was 12 years ago, there you go. we identified 4 broad categories of global change, and I just want to touch very briefly on all 4 of them. Climate change is one of them. Actually, it should be climate and atmospheric change, because it also includes acid emissions and ozone depletion and things like that. Pollution and ecotoxicity, resource depletion, and loss of biodiversity and of habitat and species, and so on. All of those have implications, and all of them are happening simultaneously, and moreover, they often mutually reinforce each other and act synergistically. So I'm hoping that this is not new for many of you, and I'm just going to skip through it. But the health impacts of climate change are both direct and indirect. The really big ones are actually the indirect ones here. Disruption of agroecosystems, inundation of cities, eco-refugees, all of that. The direct ones tend to be smaller, although this one, the vector-borne diseases, mosquitoes and in particular malaria and things like that, with global warming, spreads both in latitude and in altitude, and so you expose more populations potentially. So that's quite big. The point about this is that when it comes to climate change, it's the cities like San Diego, it's North America. Here's, is that Toronto? Yeah, okay. So it's cities in North America that contribute most per capita to CO2 emissions. So one of my messages throughout this is going to be, yes, look at global health, but you better, and we'd better, look at our own backyards, and we better walk the talk here. You have no credibility, as those of you who've done this know, going out into cities such as Mumbai or wherever it may be and talking about how they really need to conserve when we are profligate here. So if we don't deal with our own mess in our own backyards, we have no right to go around the rest of the world telling them. My wife once told me that I was, and this was before I actually did this, she was very prescient, once told me that I was going to be one of those people who fly around the world telling people to ride bicycles. and there is more truth in that than I care to think about. But the second big one is pollution and ecotoxicity. And we know that there are direct relationships between air pollution and cardiovascular and respiratory mortality and morbidity, and they're quite significant, even in North America. In Ontario, southern Ontario, it's estimated something like 5,000 deaths annually as a result of urban air pollution from this. And that's just one small part of the picture. There's relationships to cancer, but also of great concern, I think, is ecotoxicity, the widespread contamination of our ecosystems, the fact that all of us in this room carry a body burden of persistent organic pollutants. And we have absolutely no idea what that's going to do for us. And people keep saying, well, it's not a problem because life expectancy is increasing. Well, actually, I was born in 1948. I'm only 60. And so my generation, which is really the first generation to have been exposed since birth in a significant way, we haven't reached the age yet when we can tell whether or not it's going to have an effect on our life expectancy. So to say that we're okay, life expectancy is going up, it can't be a problem, is completely false. We don't yet know. We're in the midst of a large, unregulated, actually unethical experiment to find out what happens when you expose the entire population to persistent organic pollutants throughout their lives. We have no idea what that means and what the implications are. But we have lots of indications that there are widespread subtle developmental, immunological, and behavioral effects which are very hard to pick up, particularly because there's no control population. We're all exposed. So you don't really have a control population you can look to that is contaminant-free and make a comparison with. So anyway, there's much more on that, but I'm not going to go into that. But again, and this is just one small example, waste production, this is solid waste production per capita, so it's only it's not really directly speaking to this, but it was one slide I found that I could throw in quickly. But pollution levels in the OECD tend to be higher than in Asia and Africa, but not necessarily, certainly in terms of per capita solid wastes. But nonetheless, we tend to be the major sources of pollution again, although, as we've heard, we've now successfully exported that to have other nations producing our pollution for us. Then there's the health impacts of resource depletion. And I always think about the 5 Fs or 6 Fs, however many it is, of food, lands, fossil fuels, forests, fisheries, For some strange reason, all the resources begin with F. But the impact of that resource depletion directly in terms of malnutrition and hunger and waterborne disease and all sorts of other impacts of depleting those resources, and then indirectly through social and economic decline as we eat through those resources, particularly fossil fuels perhaps, but also the fisheries and food lands. And the potential, and not even potential, we're actually beginning to see it, of conflict and war over resources. Which have huge health impacts, of course, and we see that in many parts of the world already. And again, this is just pointing to energy consumption per capita. So I'm going to skip right past that one because I want to move on. This is the final form of significant global change and its health impact. This is, as we go from the first two into the third and fourth category, it becomes less clear exactly what the link is and exactly how we can quantify the health impact. But I think it's there. What we're doing when we undermine, when we destroy habitat and we have species go extinct and we reduce biodiversity, what we're really doing is undermining the integrity of the web of life of which we are a part. And the really interesting question, another of those unregulated experiments, is just how many threads of the web of life can you snip before you snip some that are fundamental to our existence? Interesting experiment. We'll see what happens. But this is that famous quote attributed to Chief Seattle. And we need to remember that whatever we do to the web of life, we do to ourselves. So these are... and this is sort of a summation of all of that. This is the ecological footprint of some cities. At the top is Seattle, I think it is, and Santa Monica. Below that, the second set of bars is Oslo and Norway. And again, coming down here, and you come down to Nairobi and Kenya at the bottom. So this is for the city and for the country. No question at all. Ecological footprint is kind of a nice summation of all of our impacts pulled together. We have no right going down here to Nairobi and telling them how to lead their lives and save the planet. Or actually, it's not really the planet, incidentally. The planet will be fine. The planet will survive, life will survive, humans may be in trouble, but the planet will be perfectly okay. So no point in going out and telling folks in Nairobi how to lead their lives when we're doing this. So there is this strong element of working at home, and I think as you work on this issue of global change and urban health, you need to be looking at what you're doing right here in the Bay Area, and I'll come back to the Bay Area in a minute. In fact, I'll come to it right now, because sea level rise and cities, and I'm just going to skip through here. This is what's called the low elevation coastal zone. You can find this in the UN Habitat Report. I'm not going to go into it in detail. They've got lovely maps in there, which I'm not going to reproduce. It's the area less than 10 meters above sea level, represents about 2% of the world's land area, but 10% of its total population. There are 3,300 cities in the low elevation coastal zone around the world, of which 64% are in developing regions. Now, 10 meters is higher than the reasonable prediction for the next century, but we really don't know what happens if the Antarctic ice shelves collapse and the glaciers start sliding off of Antarctica and Greenland. So it could be much bigger than we're projecting at the moment. But these are the areas that are going to be affected by sea level rise, whether they're necessarily inundated. Of those 3,300 cities, 1,100 are in the developed world, and one of them is right here. This is from the, what's it called? The Bay Center for Development and something or other. Conservation, I think. Anyway, this is a plot of what would be inundated with a sea level rise of 55 inches, which is not implausible. And they've actually got a series of maps that show a mid-century sea level rise of either 16 inches or 55 inches. And this one is sort of a composite of all of that. This is from the corporation. But what's really interesting is right here in your own home, Rising Tides, an international competition for ideas responding to sea level rise in San Francisco Bay. they're actually having an international design competition. How are we going to respond to all of this? How many people knew about this? Okay, so here's something right in your own, literally in your own backyard, that so they're hosting an open international design competition for ideas to respond to sea level rise. You might want to be part of that. You might want to look at that and think about how that relates to a similar situation in, let's say, Dhaka in Bangladesh or wherever. But it's a global phenomenon. So let me move on and talk about some of the how, and talk a bit about healthy urban governance. And as George said, I was a member of the Knowledge Network on Urban Settlements, and I was there because of my interest primarily in healthy urban governance. And my work, I have to say, has been primarily in Europe and North America. I have not worked to any degree in developing world situations, but I think the principles of healthy urban governance are essentially the same wherever you go. So this was the definition that Len Dool and I came up with back in 1986 that's remained the fundamental definition of a healthy city. And it is in many ways, although we didn't call it that at the time because no one was talking governance very much back then, but it is in fact a definition of healthy urban governance. It's about a continual process of change and of managing change. How do you create and improve physical and social environments? How do you expand community resources, which means community capacity and community members' capacity as well as the capacity of the community itself? How do you enable people to mutually support each other? Len was always on about mutual support, about what he called reciprocal maintenance, and how fundamental reciprocal maintenance or ideas of reciprocal maintenance are to cities and to communities. And then we also define this, you'll notice, in terms of it's about performing all the functions of life and developing to maximum potential. We really were going beyond health. We really were saying this is about human development. This is about people achieving their maximum human potential. Health is just one piece of that. And although we're in, and I'm in the health game, it's really a bigger agenda. It's how do you improve human development? How do you help people achieve the highest level of human potential and that they're capable of? Governance then, and this comes from the report. And how many people have seen this report? This is the report called Our Cities, Our Health, Our Future, which comes from, which was the report of our Knowledge Network on Urban Settlements. Have people seen this? How many people have seen it? You might want to take a look at it because this is the report to the WHO Commission on Social Determinants of Health by our Knowledge Network. And it talks about what are the challenges facing cities, and it was very much focused on developing world cities. And I was there working with a whole group of others on this issue of healthy urban governance, and that was one of the sort of background papers that we wrote for this report. So governance is management of the course of events in a social system, broadly termed, and as UN Habitat put it, it's the sum of the many ways that individuals and institutions, public and private, plan and manage the common affairs of the city. And that's really what we were getting at with healthy cities too. So they're much the same. So some of the implications of this UN Habitat definition of governance in cities is this. It's more than just government. It involves all of the stakeholders in the city. There's also this notion, I talked about healthy public policy, but in recent years I've also started talking about healthy private policy, and that is the decisions of the corporate sector that are that have significant public effect. And the story just now about the pig farms is actually a very good example of unhealthy private policy. So how do you engage the private sector who make all sorts of decisions that are not necessarily subject to public decision-making or regulation? An example I often use around the whole issue of obesity that has everyone so consumed, so to speak, is portion size. I cannot imagine that we're going to have the portion size police, that we're going to start regulating portion size. I think that will remain a private policy decision, but it's hugely important. So how do you engage the private sector in moving from unhealthy private policy to healthy private policy. And some of it may be through legislation and regulation, but some of it will not. And for the part that will not, how do you engage them? Lending policies in urban form is another example I've come across where a group that I was working with as a consultant wanted to build a sort of really healthy city form in a piece of property northwest of Toronto. They weren't able to in the end because it was new and different and therefore risky, and therefore the funders wouldn't fund it. So it was their decision that actually led to the failure of that development. And they instead they built the same old schlock because it's the same old schlock that sells, and that they could get funded. Governance requires involving both community organizations and individual citizens, so community empowerment, community engagement, participation, all of these are really fundamental. And then the final part of that definition talked about the common affairs of the city. So what are the common affairs of the city? Is there a way to even bring together and come to an understanding of the common affairs of the city, and how do you do that? What is the common concern? Healthy cities has often been quite a useful common concern, but so has been sustainable cities, livable cities, green cities, safe cities. At one level, I don't really care what you call it, as long as what you're doing is bringing together the stakeholders around developing that common concern and that common vision, because usually, even if you start with safe, you end up with sustainable, or you start with sustainable, you end up with livable, because they're all totally interconnected anyway. So it doesn't really matter where you start. I've never actually traced this down to see if it truly is an African proverb, but it was presented to me as an African proverb, that the nice part about eating an elephant is it really doesn't matter where you take the first bite. And we are trying to eat an elephant with all of this, but we just have to start somewhere, and they are all interconnected anyway. In our report, and in the report of the Knowledge Network, we talked about healthy urban governance. This was the definition that was in there. The systems, institutions, and processes that promote a higher level and a fairer distribution of health in urban settings, because the issue of equity was front and center to the work of the WHO Commission, of course, and a critical pathway for improving population health. It means putting health equity and human development at the center of government policies and actions, which gets into why you need to engage with political scientists and public administration and municipal government and so on. And then also building on and supporting the community grassroots efforts. So it's both. I think of it as the nutcracker effect. You have to have a top-down and you have to have a bottom-up, or you can't crack the nut. And then how do you bring together, as I was saying, all of these different stakeholders? How do you bring them together to develop that common vision and that common approach? So reinventing urban governance, the report says, is in practical terms a matter of building relationships and redistributing resources through trust, reciprocity, and accountability mechanisms. I would say that from the point of view of a research agenda, these are some of the things you need to be looking at. You need to be looking at what are the processes, what is out there that's working, how do you take it where it's working and take it to other places, how do you fix the processes that are not working. So it's about the how, and it's about how do you make change, what are effective ways of making change, and there's lots and lots and lots of examples out there we can draw from, and a number of them are in that report. So how do you make that change? We know what the change is. That's not really a mystery. We've got that fixed, I think, by and large. And the details may differ, but the basics are the same. So, some of the key aspects: common vision and common purpose, political commitment, intersectoral action, community engagement, and supportive national and international policies. And that's a very important part of this, that at every level, in Canada, for example, municipal government is not within our constitution. So municipalities are the creatures of the province. The federal and the provincial governments have constitutional status. The municipalities do not. So, for example, the government of Ontario was able to forcibly amalgamate the 6 municipalities of metropolitan Toronto into one city, in spite of the fact that referenda in those 6 municipalities shows 75% opposed to amalgamation, or roughly that. So the issue of how wisely higher levels of government and international agencies either support or fail to support municipal government is very important. So political commitment can be symbolic, of course, and that's not without its value, and there's lots of that, declarations and resolutions. But what you need to look for, and again, this speaks, I think, to the research agenda, is what are the whole of government approaches? Are there structures and processes in place, staff and resources, preferably reporting to mayor and council, that bring together this whole of government, that go across the different sectors of government? The committees and work groups, are they doing health impact assessment? Are they developing healthy public policies explicitly? And there's lots of tools out there for doing health impact assessment, but are they being put into place? So those are some of the research questions, potentially, that you might look at. In terms of the way I think about overall this notion of intersectoral action, my point here is that within government, you need to have this going on, whether it's at the local level, you're working across government at the local level, or across government at a national level, or for that matter, across academics, in your case at a regional level perhaps, or potentially internationally as well. So it's within those nodes. So this whole thing here is whole of government, whether you're talking whole of government at the local level or whole of government at a national or international level. Intersectoral action is about intersectoral action across major stakeholders, the public sector, the community sector, the private sector. Who are your partners? Who do you partner with? And I wrote a piece probably 15 years ago now about partnership, which I called caveat partner, beware of your partner. Too often we partner up with people who, if you really look closely at it, their bottom line does not improve if population health improves. A very good example is the pharmaceutical industry. If we all live in perfect health to 100 years old and drop dead, they're out of business. They depend upon a chronically sick population to market their products to. So who do you partner with? Well, maybe not with the pharmaceutical industry, but whose bottom line improves when health improves? Those are the people you want to partner with. So who has a shared benefit? And then do you need something like a Healthy City Leadership Council that brings all of these different stakeholders together at a high level? And how about, as I've already mentioned, healthy private policy? So what happened there? Oh, okay. So the third piece is community development and empowerment and capacity building and participatory decision making. Again, is this going on? How well is it going on? Where is it going on? This is all part of healthy urban governance, decentralized decision making and so on. So that's working across sectors. And then finally, these supportive national and international policies. What are they and how well are they working? So I'm now going to leap through some very quick stuff. I'm not going to be able to spend much time on managing decline because I want to get to the research questions, but let me spend a couple of minutes on this because I did foreshadow this. I went back and looked at the limits to growth. They actually did a 30-year update. This is one of the things they said in their 30-year update a few years ago. If a profound correction is not made soon, a crash of some sort is certain. James Lovelock, in his recent book, Gaia's Revenge, talks about sustainable retreat. That's an interesting notion. Lester Brown, in this book, Plan B 3.0, much the same sort of language, maybe not quite as inflammatory as James Lovelock, but saying much the same thing. And then Graham Turner, at the Commonwealth Scientific and Industrial Research Organisation in Australia, actually did something that you kind of scratch your head and wonder, why didn't we do this before? He went back and looked at the limits to growth models and looked at what actually happened over the last 30 years and compared what happened to the models. And it's quite sobering. 30 years of historical data compares favorably with key features of a business-as-usual scenario called the standard run, which results in collapse of the global system midway through the 21st century. So we are on track for what they predicted if we didn't change, and we didn't change. This is, some of you are probably familiar with this, the green line is GDP for the USA per capita over the last, over a period of 50 or so years in the USA. The black line is GPI, Genuine Progress Indicator. There's an organization right here in San Francisco, I think it's based, called Redefining Progress that has worked on this Genuine Progress Indicator. Basically what the GPI does is it subtracts the bad things. So instead of when the Exxon Valdez spills its oil and $100 million gets spent in cleanup, that's counted as a benefit. It counts as a positive in GDP. In GPI, it counts as a negative, and so on. So what's happened? Since about the 1970s, GDP has continued to climb. We're doing better, but GPI has flatlined. We're feeling worse, or at least we're certainly not feeling any better. That's just one example. This is the Living Planet Index from the Worldwide Fund. And you can see it's declined about 30% since the 1970s, the Stockholm and Brundtland reports. The turnaround decade of the 1990s, as Lester Brown termed it, we missed the turnaround in the turnaround decade. And this also from the World Wildlife Fund, humanity's ecological footprint. In about the time of the Brundtland report, we exceeded the planet's carrying capacity, and we're still going up. Where's the turnaround? I don't see it. So when you go back to limits to growth and all the rest of it, we need to take this very seriously. We are on track for at least a decline. So managing decline, basically it's a long, slow emergency. We need to think about it as a long, slow emergency. What we need, if we're smart, is a soft landing. The question is, how do we manage decline if it is inevitable, and it certainly appears to be at the moment? That's the track we're on. How do you manage it with, and how do you manage in cities with minimal health impacts, with minimal health equity impacts, without violence, because scarcity is going to bring violence probably, and how do we get decline but avoid collapse? Because decline can slide off into collapse, and that would be way, way, way worse. So there's a cheery thought for you, but the problem is, because it's not a cheery thought, we shy away from it. But we have to face this. We really have to face this, and we have to stop saying, well, it's plausible, but I don't like it, so let's not think about it. So what can Berkeley do? I contacted some of my colleagues and asked them what they thought Berkeley could do. Daniel Becker, who's director of the Brazil office for the Synagos Institute, Marty Rice, who's the regional advisor in healthy municipalities for PAHO, Helena Montero, who's a project coordinator for the Canadian Public Health Association in Brazil, Claudia Chu, who's director of the Centre for Environment and Population Health at Griffith University in Queensland, Andrew Kiyu, who's a former deputy director of public health in Sarawak and a leader for healthy cities in Southeast Asia, and Joan Twiss, right here in Sacramento, who's executive director of the Center for Civic Partnerships. I'm not going to go through what they said. It's on the handout, but you might want to take a look at it. But I will very briefly try and summarize their thoughts and mine with some thoughts about what you can do. You can look at healthy urban governance. What works? Incidentally, for those of you trying to follow my PowerPoint, I added some more slides yesterday, last night, so it's not quite the same as the handout you have, but close enough. And this new version you'll have. So look at healthy urban governance. What works? What doesn't work? Why doesn't it work where it doesn't work? And why does it work where it does work? And what can we learn from that? And how can we transfer it? But also look at cities in the developed as well as the developing world. I forget who it was now, but one of them suggested kind of a twinning of experience. So maybe you twin with Dakar because you face a similar sort of climate sea level rise situation or whatever. I don't know, but twinning cities that face similar global change problems, an interesting idea, because it's a two-way street. And I'm sure I don't have to tell you folks in the room, but it's not that we need to teach the rest of the world what to do. We need to learn from the rest of the world about what to do. So we need to bring ideas back here to North America. And as I say here, look at US cities too. Start at home, walk the talk. Some questions to ask. Is there common vision and common purpose? Is there political commitment? Is there intersectoral action? Is there community engagement? Are there supportive national and international policies? Are they present? If so, how did that happen? And is it actually making a difference? Because we think these things make a difference, but do they make a difference? By and large, we have reason to say they do, but it's always worth pursuing that. And if they're not working, why not? And then think about how do you manage decline in cities? How do we do this both in the USA and the OECD countries and elsewhere around the world? And with that, I will turn it back to George. Thank you.
Thank you very much, Trevor. We're running a little late, but we do have time for perhaps two questions and comments. As Eva said, we will have time both during the lunch and the afternoon to continue to discuss these, and Trevor is here all day. But are there two burning questions that must be addressed? Is there one burning question that must be addressed? Yes.
I just have a comment. I mean, I think you were bringing the example of the pharmaceutical industry in terms of who do we partner with, and especially when we think of really who's benefiting, or what really would they benefit from the world being the most healthiest place. But I think in the situation that we are, it is important, I think, to partner with pharmaceutical companies. Partnering with the devil at least allows you to, I think, move forward in certain areas. For example, incentivizing them to actually put their money into R&D that would actually benefit our developing countries, diseases related to developing countries. I mean, I think it is important to have that in mind.
I think it's an interesting debate. We don't have time to get into it now. But I'd raise it because I think that sometimes you need to confront some of those uncomfortable factors and really seriously think about who you partner with and why, and who stands to gain what.
Absolutely.
There's one over there.
A quick comment. I would just push back a little bit on the idea that we have all the tools we need, because all of these interventions that humans and institutions make are changing the ecosystem. And swine flu is a perfect example. There are new pathogens emerging, drug resistance. We do need new tools. And so I think the research, even at the discovery phase, needs to be driven by these changes in the ecosystem and behavior, in part because we don't understand behavior change. And we're not able to react in real time and respond to some of the impacts of that change.
Yeah, and I wasn't trying to say that we don't need more research and we don't need more knowledge in those areas. We do, but by and large, when it comes to the big issues of global change and how they impact on health and what we can do about it, I do think we basically know. The devil's in the detail, I agree, but there's a lot we can do right now because we know a lot right now, and we shouldn't be held up by saying we don't really know what to do.
All right, one quick one.
It's kind of part comment and part question. And the comment part of this is that I see how, as somebody who's been through various different departments within the university, my impression is that people, for instance, in certain departments, like the political science department, will focus on just very narrow analyses of situations. And in some ways are very detrimental to the idea of public governance, because it prioritizes the state, and prioritizes the state as the actor, as the primary subject, rather than people, rather than the people within the government, within the state as the primary subject. And so I'm curious how you would address that.
Well, let me make a really clear distinction between government and governance. I wasn't talking about government, although that's a very important part of governance. But governance is much bigger than government. It is all of the people, basically, at a fundamental level, it's all of the people in the city. So government is a key player. I think one thing that's very clear is if you have a poorly functioning government, you're more likely to have a poorly functioning city. And so we need to improve both. But governance is a much bigger issue than government itself and the people within government. But at the same time, you can't exclude government. It has all sorts of powers that we need to be used well. And so how do you make sure it works well as opposed to working poorly as its contribution to the issue of governance? But part of its role in governance is to work with all those others, bring them in, to have policies that enable citizen participation as opposed to policies that exclude citizen participation, that sort of thing.
Thank you very much. Our next speaker, I'm very happy to say, is Alex Eze. Alex is the Executive Director of the African Population and Health Research Center in Nairobi, Kenya. He has more than 20 years of experience working in public health and has authored many research publications. He's also been a key leader in linking different types of institutions, research institutions, academic institutions, policy institutions, and practitioners. His key research interests include health inequity, health consequences of third world urbanization, gender, and reproductive outcomes and domestic violence. He has a PhD from the University of Pennsylvania, an MA in demographics, also from the University of Pennsylvania, and MSc in sociology from the University of Ibadan. And once again, Alex, we thank you for coming this long way.
Thank you, George. It's really a great pleasure to be here. And I met Trevor last October at the International Conference in Urban Health in Vancouver, where he received an award from the International Society for Urban Health. This year, the African Population and Health Research Center will be hosting that meeting in Nairobi, October 19 to 23, and you're all invited. We are looking one of the events we'll be doing is what we call Urban Champions Forum, where we're bringing in mayors and city leaders from different parts of the developing world and also the developed countries to share experiences on what has happened or what has worked in some cities that could be applied in other settings. Just as a small commercial for the conference in October, and I hope many of you will be able to join us in Nairobi. I think Trevor looked on the how and largely made the point that some of the what we already know, which is really true. And if we apply, largely true, if we apply exactly what we know currently around urban health, the chances are that we could make huge improvements on outcomes and improve health outcomes in cities. I just want to go through again where we are with respect to urban, I'm looking at demographic shifts and demographic change and its implications for urban health. And one of the points I want to make is that current projections suggest that between now and 2050, the world will add another 2 billion people to its current size. And all that increase will occur in urban areas of the developing world. Currently, we do know that there is a common understanding that a lot of the growth of cities and urban areas globally are driven by rural-urban migration. And I think as we went through the initial discussions, there are questions around migration and its role. I hope I won't disappoint you by indicating that most of the growth in the developing world, and particularly in Africa, will be driven by natural increase, which is the excess of births over deaths. And largely, some of those births will be unwanted. We do know from a number of scattered evidence in different parts of the world that the health circumstances of the urban poor increasingly is worse than any other population group in the countries, whether you're looking at rural areas or urban non-poor. And if we're going to make an impact in terms of improving the vulnerabilities the urban poor face, we may need to understand it better, characterize it better, and develop new strategies for dealing with that. And finally, I just want to, as a take-home message, that while there are constraints to programming within the urban environment, there are also lots of opportunities, particularly the opportunity to have significant impact because of the concentration of people within specific geographic areas. This is something that, okay. We have to deal with the colors because I think there it would be a different color altogether. But here in the white is the developed countries and the more developed countries. And it's showing that over the next 40 years, there will really be little or no change in their population. And a lot of the growth that will occur in the developing world. Almost all the growth will occur in the developing world. This is sub-Saharan Africa, and it's also showing it currently is under 800 million people, but by 2050 we expect it to reach 1.8 billion. That's almost another, of the 2 billion that will occur globally, 1 billion of that will occur in sub-Saharan Africa, and it's important to understand that. And, so if we look at the change in population shifts, one of the things we will know is that I think the point was made earlier that last year we celebrated the fact that half of our population globally live in urban areas. For the developing world, majority of the population, the rural population will continue to grow up to about maybe 2015 to about 3.2 billion people. And after that, will continue to decline. And by 2050, there will be less people in rural areas of the developing world compared to what it was by 1990. Yet, if you look at the urban areas, we also see this phenomenal growth. That when I tell you that nearly all the population, in fact, more than the growth that we will experience over the next 40 years will occur in urban areas of the developing world. You look at currently at 2010, we're expecting 2.6 billion people. That will go up to 5.3 billion. So almost 2.8 additional billion people in urban areas of the developing world. So again, one way to show this is where we are globally for the world, that by last year, we actually have this crossover, which is the first time in world history where more than half of the population of the world will live in urban areas. You look at the more developed countries, again, they reached this milestone more than 50 years ago, before 1950. So this has happened in the past, and almost all the growth that's occurring there will happen has been occurring in urban areas. For the developing world, we will be reaching this milestone by 2020, and for sub-Saharan Africa, maybe by 2030, thereabout. Sometimes when I look at this indicator, I feel that it would have been great if sub-Saharan Africa is only 20 years behind the rest of the world in terms of reaching critical milestones like improved mortality outcomes or improved health conditions. But I think for many of them, it will be so many decades. This chart here shows what drives the urban growth in the developing world. Across developing countries, about 60% of the growth is really due to natural increase, which is the excess of births over deaths. In Africa, it's about 75%. It's not very difficult to understand this when you understand the population shifts and structure of rural areas and urban areas, where due to previous, again, let me clarify here that in the past, rural-urban migration has been a major driver of the growth of cities and urban areas. But currently, and going into the future, because of the population structure, the age structure of populations in urban areas, with selective migration of young people entering into the reproductive ages, you are going to see these patterns where births largely will drive growth of urban areas. I give you an example with Nigeria. Again, we compare birth rates and number of births using the crude birth rate and the difference in fertility between urban areas and rural areas with the projected population of urban areas and rural areas in Nigeria. What you see is that currently, the number of births in Nigeria occurring in rural areas will continue to decline, whereas the number of births occurring in urban areas will continue to increase. And this happens when increasingly more people live in urban areas and they have a structure that suggests much younger population in the childbearing ages compared to rural areas where you might have more older population or selective migration of young people to cities. You get these patterns where largely most of the births occurring in the developing world will be occurring in urban areas. As I indicated at the beginning, some of these births and growths are actually coming from unwanted fertility. And I just give a couple of countries here to show that if you take a place like Zambia in 2002 demographic and health surveys suggested that about 48% of recent births were reported as unwanted. If you can eliminate this, you can actually slow urban rates of growth of urban areas in these countries. One of the major consequences of this rapid rate of urbanization, particularly in Africa, is the fact that it has occurred under economic stagnation or decline in a number of countries. I know currently we're dealing with the financial meltdown, but if you look at the World Bank report, I think it was in 2004, it suggested that between 1970 and 1994, urban areas in sub-Saharan Africa grew on average by 4.7% per year. During the same period, GDP per capita dropped by 0.7% per year. So one of the things we've seen is growing poverty in many of these cities. And if you take any of the countries where there has been improvement in the proportion of people living below the poverty line, like in Nigeria, the improvement has been more in rural areas in red than in urban areas. If you look at Kenya, where there was a worsening of the proportion living below the poverty line, the increase has been much more in urban areas, almost a doubling compared to rural areas. So there's been growing, increasing proportion of the urban population that live in poverty. The implications of that, again, from this UN Habitat report in 2003, is that globally, about 1 in 3 people living in urban areas live in slums globally. In the least developed countries, you're looking at about 78% and 72% in sub-Saharan Africa. To understand this, so again, that varies across many different regions in the region, showing that increasingly with poor economic performance and rapid rates of urbanization, many of the people in urban areas will increasingly live in slum-like conditions. This, I got this information from both UN Population Division, their 2009 World Population Prospects revision, and the UN Habitat estimates of rates of growth of urban areas, rural areas, and slums. Again, globally, the population in rural areas will be growing by about 0.4%, and in urban areas, it will about 2%. And in the slums, about 2.2%. If you look at sub-Saharan Africa, still huge rates of growth of the population. But slums at 4.5% means that the slum population in sub-Saharan Africa will double every 15 years at this rate of growth. And you can see that by 2020, we will have more people living in slums in Africa than the current population size of the United States. Again, these are the magnitude of implications that we are looking at. I've run through a number of data points and indicators. There might be questions about this reliability of these estimates from the UN and all that, and margins of error and all that. But I think one point I want to highlight from this is, what is really important? Sorry. Do the urban poor have worse health outcomes? And when you ask that question, the key point is, who are we comparing them to? Are we comparing them to the urban non-poor, to the rural poor, or to the rural areas as an average? What is the relevant comparison group when we look at the urban poor? And when we think about the urban poor, should we actually look at that as a category in and of itself, or should we look at slum residents? When you ask this question, what we're trying to get at is whether there are slum-specific effects over and above the effect of poverty or being poor in urban areas. Does living in a slum environment actually have implications for health outcomes? Again, from the World Bank, there is, I hope not very clear, that a number of issues that drive the vulnerability that urban populations face, including the issues of inadequate housing, insecurity of tenure, unhygienic living conditions, and a number of things that they drive this sense of insecurity, isolation, and disempowerment that largely influence health outcomes in a number of cities. So if you look at those characteristics, you can actually pull together 5 key aspects of slum residents that inform the UN Habitat report. One of them is the issue of housing quality. And again, looking at the type of housing, whether they are permanent structures or not. Density of settlement, looking at overcrowding, whether you're looking at it per room or per geographic area, per square kilometer or per square mile. Security of tenure, looking at protection from eviction, unlawful eviction. Do people have secure tenure where they live? And issue of basic amenities, particularly water, and again, sanitation, looking at toilet facilities. On top of all this, if we're going to redefine these indicators now, I think I will emphasize the issue of informality. And informality here, we're looking at it in terms of the services, whether it is schools, whether it is health services and health facilities, or even employment. In the slum environment, even people who work in the formal sector may have informal contracts. And trying to understand the informality of life and of services in these settings can be one measure of looking at slum environments. So how do the slum environments affect health outcomes? And again, if we're going to be looking at improving urban health, this becomes one of the key challenges that we will need to address. The unfortunate part in trying to answer this question is that we often do not have good measures of health for the slum areas. If you take any of the national surveys, it's difficult sometimes to identify areas that you can define as slums. What we did in Kenya in 2000 was to rely on the 1999 census listing to identify clusters, the enumeration areas that can be defined as slums. And we did a survey covering a representative sample of these households. So for the first time, we can actually show what health outcomes look like for people living in slums in any city in Africa. And we did a report on that and compared this result to national indicators using similar instruments for Kenya. And one of the indicators we looked at is the issue of diarrhea, which looks at the proportion of children under 3 years of age who had an episode of diarrhea 2 weeks before the survey. In Nairobi as a whole, which includes the slum and non-slum areas, this is the average for the city, it's 13%. 17% in rural areas, and in Kenya as a whole, 31% in the slums. If you go further and you look at these incidence of diarrhea, again, for the slum areas, as I said, it's 31%. If you look at the distribution of these by wealth quintiles, you see, for the poorest 20% for children in the poorest 20% of the households in the slums, 43% of them had an episode of diarrhea 2 weeks before the survey. And it goes down to about 25% for children in the richest 20%. You can do the same thing for rural areas from this national survey. And what you see is that you still see the same gradient from 19% to 12%. But what is really surprised us is that when you compare the richest in the slums at 25% and the poorest 20% in the rural areas, children of the richest 20% in the slums actually have higher morbidity than children of the poorest 20% in rural areas. Again, are there slum-specific effects in health outcomes, and how do we understand and characterize this? You can look at other measures of morbidity. This is the proportion with fever. Again, almost 2 in 3 of children in the slums had that. You can compare it to other population groups in Kenya. If you focus on these children with a health condition and you ask the question, what proportion of them actually had access to health services? What proportion of them were taken to a health facility? Less than half in the slums, and compared to 58% in Nairobi as a whole. And you can compare that to other subgroups in Kenya. So the issue of lack of access to services is also very evident when you look at immunization coverage, the proportion of children 12 to 23 months who were fully vaccinated, less than half in the slums. Again, one point to note here is that there's been a deterioration in immunization coverage in a place like Kenya. But even in the more recent period, there's still more children outside of the slums who are vaccinated than in the slums. Consequently, infant mortality and under 5 mortality are almost 40% higher in the slums compared to rural areas of Kenya. So if you look at rural areas and you compare that to this, you look at 79 versus 91, 117 versus 151. So actually, children in the slums, not only are they sicker, but they are more likely to die before their 1st or 5th birthday. What are the implications of this? And what are the drivers of these health conditions? Again, when we saw this result in 2000, we started to ask the question, how do you set a platform that can help you understand what's going on within these slum environments? So we started a longitudinal study that follows up about 60,000 individuals in some 22,000 households. We visit them once every 4 months. We started with a pilot in 2000, and 2002 we scaled it up, and we've been working in 2 slums covering this group of people. We collect information on births, on deaths, and for the deaths, we do verbal autopsy. And we also collect other information in other areas, economic activity, marriage, schooling outcomes, and all that. And what we see here is that 3 basic conditions, pneumonia, diarrhea disease, and conditions associated with the birth conditions, stillbirths and other perinatal causes, account for almost 2/3 of the disease burden within the slum environment. Again, you can look at the total DALYs here with the person years is quite huge. And if you look at what proportion, again, this goes back to the point that Trevor made, that 90% of the mortality burden in the slums can be addressed with proven cost-effective health interventions. Yet, why are the children dying? You look at you include morbidity or disease. Again, 81% of the disease burden in these communities can be addressed by proven cost-effective interventions. To just let you see the implications of this pattern of morbidity within the slums, actually, for adults, what we've seen is the role of HIV/AIDS and TB, about 42% of the disease burden related to that. Again, injuries is at 17%. So when you think about urban health, there are certain issues that maybe we've not paid close attention to. For sub-Saharan Africa, injuries will account, according to the WHO estimate, less than 8% of the disease burden in sub-Saharan Africa. But that's double here. And if you look at these injuries, there are only 3 major causes. You look at gunshot wounds and blunt injuries, looking at domestic violence largely, and you look at traffic accidents and alcoholism. They are the 4 major lead, and they account for like 95% of this burden, just the 4 items like that. And you can look at these neuropsychiatric disorders. Again, we've not fully understood how the urban slum environment affects mental health conditions in these cities. And there's areas where new data will be required to really understand what's going on. I just used evidence from a place in Tanzania, Rufiji, where they conduct similar studies like what we do in the slums, to show you the magnitude. This is a coastal region, Rufiji in Tanzania. Just compare the under 5, but the DALYs here, per capita burden, that's for the slums, is almost double what you have in Tanzania. And yet, you also look at children older than 5, this is 280 compared to 1366 for children under 5. Looking at the heavy burden that children under 5 bear in this particular environment. And you can, so when you see mortality rates of 153, under 5 mortality rates of 153 in these slums, it is real, and it is a huge burden within these communities. So to what extent do these conditions of the slum environment impact on health outcomes, whether you're looking at access to clean water or toilet facilities or overcrowding and all those things we've looked at before? And how do we address these conditions? What should be? How do we improve health outcomes among the urban poor? Should our investments focus on making health, family planning, and reproductive health services more accessible to the poor? Or should we actually focus on addressing the environmental condition that affect morbidity patterns in these settings and condition children's susceptibility to disease and death? Or do we deal with the underlying poverty that characterize these even residents in the slum environment, or a combination of these various factors? And what will be the cost? How do we compare the impact of those to some of the major initiatives of governments and development partners around slums upgrading? Where do we get the best buck for the money, for the investments that we want to put? And what should be the optimal delivery strategies for these particular programs and interventions? I just want to end this presentation by using our experience in the slums over the last 7 years, 8 years that we've been running these longitudinal studies to challenge us to think outside the box when we look at addressing urban health challenges in the 21st century. I used 2 examples. One of them is a voucher program, which covers areas of family planning, delivery for pregnant women, and gender-based violence. Again, this is a system where people can pay like $3 to get a voucher for delivery, so that when they go on to deliver, even if it costs $100, somebody else will cover the difference. But with the voucher, that they have already bought when they were pregnant, they can actually go and deliver at those health facilities. And the second one is on free primary education, which is a national policy that the Kenyan government adopted in 2003. We've tried to evaluate this voucher program within the slums, and lots of women, maybe close to 70%, were able to buy the vouchers. But about 20% of the women who bought these vouchers were not able to use it. And you can ask the question, why would a poor woman in a slum environment spend $3, which is more than what they may make, some of them, in a week or something like that, and still not use it when she is ready to give birth? Or why would she, instead of going to a proper health facility, end up in a place like this within the slum environment to give birth? Just think about it this way. In many of these slums and in these ones where we work, if you are in labor at 2 o'clock in the morning, how do you get to the health facilities that are certified to accept those vouchers, which are largely outside of the slum environment? There are issues of concerns with security and all that. So even when you have the voucher, depending on the time that you get into labor, you may not even be able to use it. And yet, in this place, you might have women who are retired midwives because they are 55 years old or 60 years old, the retirement age is 55, living in these communities. Can there be ways where you can actually, whether you need to retrain them, give them cell phones, find ways where you can actually engage them so that if this woman is in labor at 2 o'clock, they can call her, she can come in, and we know that the presence of a skilled attendant at delivery can drastically reduce maternal mortality outcomes. So in this community, we observe maternal mortality ratios of 706 compared to about 480 for Kenya as a whole. So this huge burden can be addressed by building on community resources that may exist in these places. Again, let me look at the education program. The government of Kenya introduced the free primary education policy in 2002. In 2003, we saw enrollments increase, but it has continued to decline after a while. But one of the things we also observed is that by 2005, nearly 60% of the children in the slums were attending non-formal, non-public schools. So the government policy is to provide education to every Kenyan child. Yet, 60% of the children in the slums were not benefiting from this policy. And the question we're asking is, why would a mother send their child to this school, which is a non-formal school, non-public school in the community, than this school, which is also in the community, but is a public school? Last November, we had a meeting with the whole Ministry of Health establishment, from the minister to the assistant ministers, the permanent secretaries, directors of school programs, and the assistant minister got up and said, the answer is very simple. The cost of getting your child into this school is more than what you pay to get them through this school, whether it's because of corruption and other things. And what we've observed is that in the slum environment, the people who are not able to get into the public schools, there are only 2 public schools in this community to serve 7,000 children of primary school age. So it is the poorest in the community who are not able to get into this type of school. Again, a policy that is meant to help the poor, ending up disadvantaging them the more. The minister and the permanent secretary, at the end of this 2-day meeting, decided to redefine what a school is in the slum environment so that they can at least be able to provide certain levels of resources to the non-formal schools that serve majority of the children. Again, thinking about a national policy, how do you apply it? How do you adapt it within the slum environment if we are going to address urban health outcomes? So some concluding thoughts. I think it is very evident that urban population will constitute the majority of the population in Africa over the next less than 20 years. And majority of this population currently reside in slums, and they have poorer health and reproductive health outcomes. Because of the growth in the number of people living in urban areas, and because of the sizable proportion of the urban population that live in slums, currently in sub-Saharan Africa, we're looking at about 72%. What happens, and our ability to drive change in the health conditions of people living in slums will increasingly determine our ability to make a difference in national indicators. Let me say that again. Because majority of the population will increasingly live in urban areas, and because majority of the urban population will live in slums, if we don't find mechanisms to improve health outcomes among slum populations in many parts of Africa, we may not be able to make significant impact in improving health outcomes overall in these countries. And if we are going to make improvements in health outcomes in Africa currently, I think we will be able to, we have to put emphasis on building public-private partnership in the delivery of healthcare. We need to build on the resources that already exist in these communities, strengthen them to the point that they can then be able to impact on the indicators we care about. And one of the examples is like working with private providers to strengthen their capacity, say in health, to provide services in line with national guidelines so that it can reduce the role of the unorthodox providers within these communities. I'd like to give the example of a health facility in the slums that is run by a security guard at the National Hospital. Somebody comes in there, he goes back to the health facility, and the person he sees is the nurse. You ask a question, describe what's going on with your patient in the community. And the nurse can give an answer or talk to a doctor and maybe get back to you 2 days later. So 3 days later, you might be providing some type of treatment. But if you can find a few private providers that you can build their capacity to provide services in line with national guidelines, you can actually then improve both access and quality of care that the poor are able to access within these environments. So, at APHRC, again, we have our website, but we are a multidisciplinary team from people from about 13 African countries and different backgrounds, looking at how to improve the well-being of Africans through policy relevant on population and health issues, including education as well. And one of the things I've shared is out of one aspect of our work, looking at urbanization and well-being, but there are other areas of our research and policy engagement and capacity strengthening as major areas where we work at the center. And you can get information more on our website, which is there on the screen. Thank you very much.
Again, we're running a little bit late, but we do have time for a couple of questions. Yes, Julie.
Hi. I was fascinated by your wealth and diarrhea in urban and rural slums in the urban area and rural health quintiles, or wealth quintiles. I'm curious how the quintiles of wealth in the slums compare to the value or the assets of those in the poorer areas. If they're wealthier in the poorer areas, or in the rural areas, or they're wealthier, how they compare that to assets.
Okay, what we did was to define those quintiles independently for the slums and for the rural areas, also because they are coming from different data sets. But when you do the average, when you do it for national and then you apply to rural, majority of the poor nationally will then reside in rural areas. But if you use the same asset base to define, again, it's not a fair comparison because of if you live in the slums, you will pay rent, you will buy your food, so it's a more cash-driven economy compared to rural areas. So poverty here, you might have more asset indicators, like many of them will have access, maybe electricity, even if it is not properly set up, or maybe have access to water and all that. But at the end of the day, so on average, the poorest 20%, their asset score will be higher than the poorest 20% in rural areas. But it doesn't mean, as we should, their health outcomes are still worse, despite having higher asset scores. I don't know if I'm answering your question.
So you're saying that the wealthiest in the slum are poorer than the poorest in the rural?
No, are better off in terms of asset measures, and than those in the rural areas. But
Question here?
Well, everything sounds to me like it's based on economics. The rural migrate to the city because even that life is better than the rural. So, but when they get to the city, there's nothing for them to do, and their condition deteriorates. Now, some of these countries like Nigeria does have a lot of wealth, but it's not going down there. So, how do you ever straighten that?
I guess that's why we are here, to think together. and go through it. But that's really the challenge. And people have questioned the estimates of urban growth in Africa, indicating that because of the increasing vulnerability of the urban poor, it may discourage migration. But again, as we show, that the growth is going to be driven by natural increase, not really by rural-urban migration. But I want to make one point. Even in the more totalitarian regimes, you're not able to control migration within the country. It's very difficult to have those policies. And when people move to the urban areas, it's like somebody coming from Nigeria to San Francisco. You might actually decide to live on the street than to go back, because going back means failure. And for many people, it's just the shame of not succeeding. And even if there's only 1% chance that you will succeed, many people will still take that chance. And when they get there and they fail to succeed, going back sometimes is not an option. We've looked at the elderly in the slums, asking the question, why are they not going back? Our model suggests that you go to the city, you make the money, you get a job, you retire, you go back to rural areas, become a chief, and life goes on better. But they're growing old and dying and going back as corpses to rural areas. Why? Because many of them do not have anything to go back to. And going back is just like telling everybody I failed. And they'll rather stay there and sort out whatever they're able to get in the cities.
We're going to take one last question. Gentleman here, do you have a question?
Me?
Yeah.
Alex,
Yeah.
thanks for a great explanation of this issue. You answered my question. 30 years ago, we were really concerned about the rural-urban bias. Healthcare, schools, job opportunities were much better in urban areas, so of course people migrated from them. My question was, you've demonstrated that the situation is better in rural areas, not the economic opportunity for jobs perhaps, but it doesn't sound like you'd expect a reverse migration anytime soon.
It's unlikely, again, because people are not looking at, when you're going to the cities, you're not looking at the situation in the slums. It's like maybe you might have 10,000 street children in Nairobi. That's not what people are looking at. They're looking at the big cars and the this and the wealth and all that. So again, the reference point and that inform those decision-making to migrate are really, more positive than the reality that we face. And that's why having a reverse migration. In some parts of West Africa, like Ghana, I think there's been some evidence that people are actually moving back to, from cities to other more rural or smaller towns and all that. But it's not been a very widespread pattern that we can say it will characterize movement and migration in the region.
Would, Trevor perhaps could answer this, would the collapse that's going to occur mid-century mean that migration would occur back to rural areas, because that's where food is? For example, in the Second World War, in affected areas, Germany, for example, people went into the rural areas to secure food because there was no other way to live. Maybe ultimately, under the worst circumstance, there might be a reversal of migration. We don't know to see that.
Again, I think it will take something like a war, civil conflict and all that to really achieve that type of movement. But if everything is, under normal circumstances where there is peace and all that, the chances that that will occur, because these are individual decisions. And, so again, you look at the global trend towards urbanization, that largely, as countries have developed, they've become more urban. And urban areas become engines of growth, with economic growth, centers of culture, anything you think about. But whether that trend will be different for Africa is something that people are debating currently. But what we know is that with the current situation in urban areas and with many people, more than 70% living in slums, that maybe there might be a shift in people's thinking, but I don't think we can. For me, if you ask me, I would say that my sense is that over the next 15, 20 years, the growth of cities and urban areas will continue in Africa. And it will be driven by natural increase, but also by selective migration of young adults.
Okay. We'll continue the discussion over lunch. Thank you, Alex. Our third and final keynote is Dr. Stephen Schneider from Stanford. We're very happy to have you up here. As some of you may noted, our first welcome speech today was from Graham Fleming, who was on his way down to Stanford. So this is kind of an exchange program. I think it benefits both sides. Stephen is the Melvin and Joan Lane Professor for Interdisciplinary Environmental Studies, a Professor of Biological Sciences, Professor of Civil and Environmental Engineering, and a Senior Fellow in the Woods Institute for the Environment at Stanford. He claims, according to the information that he sent me, that he's been a consultant to a number of different federal agencies during different administrations, one of which he starts by saying the Nixon administration. Now, I think that there was still child labor laws in those days, but anyway, he's worked throughout the last decades, doing work for the Nixon, the Carter, the Reagan, both Bushes, and the Clinton administrations. And currently, he is working on counseling policymakers about the very real importance of using risk management strategies in climate policy decision-making, given the total uncertainties, or the great uncertainties in terms of actually how things are going to be evolving. He's the founder and editor of the interdisciplinary journal Climate Change, and editor-in-chief of the Encyclopedia of Climate and Weather. We're very happy to have you here, and look forward to hearing what you have to say.
Thank you. Thanks very much, George. I was thinking when you were saying the Stanford-Berkeley exchange, so was I coming from or to an urban area? I don't know yet. Okay, we'll have a very, very different scale of activities from that which Alex talked about. And when you see that kind of a compelling discussion of the problems that people have on the ground, which are not related to some abstract thing like the climate change over time, and you realize what a priority it's been for a long, long, long time to deal with the overall question of development and making the development sustainable. So then you start to wonder, well, why are we going to worry about this rich person's problem about whether the sea levels rise and so forth? Of course, the problem is that a significant fraction of the world's population lives within a few meters of sea level, and the most vulnerable parts of the earth are probably Asia megadelta cities worried about either floods coming down the delta from heavy storms or floods coming from the ocean with rising sea levels and storm surges. And in a way, the best descriptor I've heard about the important role that you'd get in connecting climate to development problems came not from one of us left-brained academic types. You have those here too, I think. And, oh, I see Michael in the back, yeah. Anyhow, but in fact, it was from a group of retired military officers looking at the security implications of climate change. And they described it in two very clear and appropriate words: a threat multiplier. And in essence, what we're going to really talk about is that anyone who talks only about we've got to deal with climate, it's the most important priority, we have to deal with development is the most important priority, you find that these are linked. And often if you can look for ways that you can find solutions to one that help with the other, you now have two sets of constituents on board. You therefore cut the cost in half of dealing with each, and you try to find those common grounds. So with that, let me start out by saying that before you can get anyone to want to spend any money on anything, they want to be convinced there's a reason to. We certainly saw compelling reasons in previous talks as to why we ought to be concerned with problems at that scale. And why would you want to be concerned at the next scale? So the question that I get asked when I give this kind of a talk, and I'll talk to to CEO groups and to community groups and academic groups, including grad students, and then undergrads. I also talk to high schools, middle schools, and right on down to congressional committees. And yeah, just testing. Okay, and when we do that, they always ask basically the same question. Well, you want us to spend all this money and you want us to change the way we do things, first, don't you have to convince us that the science of global warming is settled? So I love to do a poll on this. I was in New Zealand about a month and a half ago, and I did a poll, and I'll ask you too, so what fraction of you think the science is largely settled? And about 75% yes. If you ask the same question in Oklahoma, it's more like 7.5%. So how is it in Berkeley? So how many of you think the science of global warming is largely settled? Easy audience. How many think it's not settled? How many think it's a stupid question? Right, exactly. And why is it a stupid question? Because we're talking about systems analysis, and anytime you have a complex system, it is simply never going to be completely known. So you have three basic components. There are components that are well established, the ones cited by the deep ecology groups when they pick the most significant well-established danger and say the world comes to an end. Then there are components which involve competing explanations. We've been working long enough that we can narrow it down to 2 or 3 alternatives. And then there are various schools which fight hard over which of the alternatives is explanatory. In fact, often it's both of them, and the real science question is the relative amount. And then, of course, there are components which are speculative, and you can count on some enterprise institute or ideologue who doesn't believe that government interventions and the private rights of people is appropriate governance, who will sit and cite the speculative elements and say that they, as long as they exist, have falsified global warming. I'll give you, or whatever it is that's your cause. And of course, it's complete nonsense to say that because there are elements that are well established and dangerous that we know everything. And it is equally nonsensical to say that because there are components of a problem that are not well understood, therefore what is well understood doesn't exist. And that was, in fact, the tactic of the American Tobacco Institute for 35 years. Cite the 3 studies that were equivocal, ignore the 33 that were very clear, and then argue correctly that we don't really deeply understand why smoking would cause cancer. So until we do, it's not proven, therefore we're not going to punish an industry for an uncertainty. And the notion that you have to know everything before you act rather than go on the basis of a pretty good empirical case. Somebody says, well, don't you? And I said, well, let's see. Do you think that the Anasazi Indians 800 years ago had a deep understanding of heliocentrism and Kepler's laws? I somehow don't think so. So why did they plant their corn in June instead of in September? Empiricism goes a long way toward improving your life when you have enough of it. And so we can sit there and figure out what happened, but we still have to act, and that's where risk management comes along. Because the role of science is risk. What can happen multiplied times your best estimate of its probability. Usually it's a function, a bell curve, with a lot of subjectivity in it. And what to do about that is risk management, which is informed by science and will not be a well-made decision without understanding the best that we know. At the same time, it's a value judgment as to whether you prefer to spend present resources you could use on clean water in urban poverty areas, or whether you are worried about some of the more serious cases of climate, for example, or other long-term problems going unhedged. So you really get into your risk aversion value system and into your relative sets of priorities, and there's no right answer. There's not even any analytic way to calculate out what the right answer is when there's different values. You just simply have to have a political negotiation, and that works best when power is equal and people understand everything equally. Well, how often do we ever see that? But there's yet another problem we can talk about. So anyhow, we'll give you a couple of examples, and then I'll get on to scale down the global stuff down toward more of the local level, and we can then see why it actually is a multiplier of problems. Well, the IPCC, the Intergovernmental on Climate Change, the UN consensus, which a number of people here have been involved in, came up with a rather interesting word, which strikes me as well established. The warming of the climate system is unequivocal. That's pretty unusual language, especially since it came from a report written by a chemist. I mean, they're usually pretty hedgy. And here was the reason for that is that the observations in the atmosphere and the oceans, the melting of glaciers, the rising of sea levels, and in fact, you could also argue the movement of plants and animals. They're all highly consistent with this picture. It's a no-brainer. So when you hear those famous climate professors who, the ones with all the refereed literature, professors Limbaugh and Will, out there telling you there's no global warming, they're just about as smart on that as they are almost anything else technical. Okay, well, let's face it, Limbaugh is an expert. Definitely is an expert on the dangers of overuse of prescription drugs. Beyond that, I think there's nothing. Okay, yeah, but while we laugh, remember where we are, they'd laugh in Stanford too. They don't think that's funny in Oklahoma. They think that you're un-American, but that's another story. We'll talk about the two cultures problem later if we have to. And then multiply that by all the cultures around the planet, and then you get to see what it's like when you get to a climate meeting that's international. In any case, what's unequivocal? That's this thing. This is 0.75 degrees C warming since the middle of the 19th century, 1.4 Fahrenheit, and that's what they're talking about. Here's rising sea level. It starts at one slope. Its slope is sort of doubled. Now, this is decreasing snowpack in the northern hemisphere. So these things are all very well established. Now that, though the data set from the last IPCC is about 5 years old, this one updates it to about a year ago. So there you can see there's lots of noise from year to year. There's a warming trend, a slight cooling trend, a really major warming trend. This one appears to be, from all the records that we can assemble, and you have to assemble many of them, to be outside of the warming that we've observed in the last 1,000 years. Does that prove that we did it? Remember, this doesn't say anything about cause and effect. All this is detection of trend. And it's significant and it's detected. The question of attribution is much tougher. How much of it's due to us? How much is due to Ma Earth? Because if it's just a natural variability, then sitting there and altering the greenhouse gas emissions, well, of course, there's a reason for that anyway, which is ocean acidity, which has nothing to do with climate. It's just connected to the emissions. But presuming that climate was part of the story, you'd want to know what relative fraction, and that's why we have to do some of the science. Now, recently I was giving a congressional testimony, and I was told by the good congressman from Orange County, Dana Rohrabacher, that he had falsified global warming because from 1998 on down, the temperature had gone down slightly, and since greenhouse gases were going up, that falsifies it because one exception disproves, the rule, which of course is complete nonsense because system science, as I said, works on preponderance of evidence, not on individuals. And the other things, as I pointed out to him, was if I, started in 92 and then went up here, we were going to hell in a handbasket. Now we've come down. That's what we call climatic noise. And that it's superimposed on an upwardly sloped trend exactly as predicted. Nothing strange there. Oh, no. That you can't tell me I haven't falsified. I said, well, I just told you, you can't. If you can't understand it, well, he does get reelected. In any case, we won't discuss four-letter oinked animals and why people get reelected. Okay, so the point is that you're going to have all kinds of nonsense out there, and we're in a democracy where we believe that equality is important, and equality is important, but science is not a democracy. Equality trumps equality, and therefore everybody has a right to their ideas, but they don't have a right to expect them to emerge in proportion to what they put into the hopper, that there's going to be an evidence-based set of tests. And so that leads to continuous fights. And if you're surprised as to why the public knew and the Congress knew pretty much what we were facing in the 1970s, because I and others, when we were in the child labor laws, were talking about John Holdren, and remember him? He was here. And now President Science Advisor and I did a number of congressional things together back in the 70s and a number of other such things. And it wasn't just in the US. Parliaments of the world knew. They, in fact, I'm just finishing up a book now called Science as a Contact Sport, which is a story of my life. It's very autobiographical. And the subtitle is 4 Decades in the Trenches of the Climate Wars. And I basically will quote stuff that we said in the 70s, and then with something said 2 years ago. It's the same thing. So how did we know and didn't do anything? Part of the reason has to do with the doctrine of balance in the media, which is very much driven by the pinnacle respect hierarchy in its profession, which is political reporting. Get the Democrat, get the Republican, perfectly fair and balanced. In science, get the end of the world versus what's good for you. I mean, that's not only not balanced, it's completely distortionary, because those are the two lowest probability outcomes, and everything else fitting in some bell curve. We spend most of our time trying to winnow out the relative probability of those things and then expect people to make a rational decision based on risk management about, you know, when you have multiple competing uses for limited resources and you want to try to understand what your risk framework is, when it's getting dumbed down into the PhDs on one side say this, and on the other side, and the public says, well, if they don't know, how do we know? And maybe we'll just wait and see till we know. And of course, there are people who are paid very well to convey that impression, and they have been effective for a long time. And they're trying again, and they're possibly going to delay further. But I'm not here for that. Couldn't resist giving you this a little bit of a epistemological frame. I can use that word in Berkeley, right? Okay, so only one hiss? I expected more. Come on. That's not good. All right, let's just go quickly. How do we know how much of this is us and Ma Earth? Well, there's no direct way to tell you, because what we measure is we measure what happened. We don't measure the fraction attributable to various causes. There is no empirical way to do that. It's theory. You have to have a cause and effect theory. Now you get empirical. You test alternative theories. You see which one works better. And then if that's consistent with belief and with a whole set of internal processes that lead to consistency, you don't declare it true. You declare you have higher confidence. And that's, again, how systems analysis works. That's how complex problems are dealt with, whether it's how do you deal with health, or what, you know, how do you deal with security, and a bunch of other issues of this type where you will never have full answers. So what that basically shows you, their black line is the unequivocal thing. This is global land, global ocean. Don't worry, I'm not going to scare you and make you look at all of these. So we're looking at three measures. The blue, I think that's my next, the blue is the envelope of climate models driven by natural causes only. Remember, there are three possible causes of variation. Natural variability, which means nothing on the outside changes. It's all internal dynamics of the system, and there's some of that. Then there is what we call natural forcing. Sunspots, volcanic eruptions, things which cause pressures on the system and then can get a response. It's externally forced, but it's natural. And it may be predictable, but you'd have to be able to predict the outside forces. And then there's the third cause, which is anthropogenic. That's what we call forcing. Also, greenhouse gases, land use change, aerosols, which cool. They can do both, actually. So anyhow, that blue is the envelope of predictions from climate models, which are our virtual realities. And we won't define the probability of a virtual right now, but it's generally less than 99. And it gives you a band, and here it is on 6 continents, the blue. What's the pink? Well, that's what happens when you drive the same models with natural plus the greenhouse gases and aerosols. And while every single one of them, you could argue, well, what's the probability that it would work in North America? Well, if that's the only thing you did, you got a 50% chance that it'll get warmer, and a 50% chance it'll get cooler, and a 50% chance the model will get warmer, and a 50% chance cooler, only 25% chance. Clearly, it's just circumstantial evidence. But when you start having it work on all 6 continents and the world divided up by global land and global ocean, it starts to look like it's a little higher probability than that. Also, it's consistent with theory, and there are other, quote, fingerprints. If the sun did it, which you can find in the op-ed pages of business tabloids, you know, like the one in Wall Street, all the time, that's the standard explanation of the same 6 people that they teach their people climate science from. Then you'd say, well, if the sun did it, it would warm up the stratosphere, the middle of the lower atmosphere, the surface. According to the models, the stratosphere is supposed to cool, and the middle of the atmosphere and the lower atmosphere is supposed to warm. So what happened? the model's got it right. Oh, but that doesn't prove it, 25% chance. But now you put that together with all of this, and there are 3 other such fingerprints, and all of a sudden the case looks pretty darn clear, and that's why IPCC said it was very likely, which in our lexicon we define words like likely on a subjective probability scale. Well, you have to, because if you do a survey of people, as good social science will tell you, that people can have an order of magnitude difference in the meaning of the word likely if the outcome is dread. So, but of course that's an error, because risk is probability times consequence, and it's not likely to be 10%, even if that's high enough odds for you not to want a poison in your food. So you don't call it likely when it's not likely, you just say I don't want to take the risk, because risk has got the consequence in it. But a lot of people don't do that, including scientists, many of whom are brilliant at a detail and have almost no epistemological vision at all. I'm sure there are none like that here. We have a record on that. Elitist institutions tend to have more of that than others. In any case, when you put that all together, it's a pretty overwhelming case. And that's exactly what IPCC has said and what most of the assessments have said for a long time. Now, how much of what I told you could I do in a 5 to 10 second soundbite on the evening news? None. Or the luxurious 5 minutes you get in front of a congressional hearing, unless then you get Q&A, you can get something done. And therefore we have a serious problem, which is when you apply this advocacy equal time model to public understanding of complex issues, and you don't have enough time. It's not like a courtroom where a bunch of extrapolating lawyers, taking the information out of context, because that's in fact that's professional ethics. If they didn't do it, it would be unethical. For us, it's unethical to do that. For them, it's unethical not to do that. But they have enough time, and if the judge and the jury understand stuff, the truth comes out. How does it come out? In a public process where there's not enough time and where people can't winnow it out and ask questions of each other. And that's a different topic, but it's a topic that relates to everything we're talking about, because getting good governance generally requires, especially in a democracy, people understanding what's going on. And then in our Republican form of government with a little r, we're supposed to have representatives who hire staff to get them the information. And, well, in theory, it's a great model. We have to, in practice, carry it out. Okay, one more shibboleth, and then we'll move on to the impacts. I hear this one all the time. How many of you have ever heard this? Oh, this is just natural. It's happened before, therefore it's natural. Well, I'll tell you, there's no therefore there. But you can't explain. This I can explain in a congressional hearing. Don't worry, you won't have to understand all this. This is a measure of temperature over the last 500,000 years. It's ocean cores. And so here's ice ages, very cold, 6 degrees Celsius, 10 Fahrenheit, colder than a warm period, like the 125,000 year ago one, which is a little warmer than now. So here we are, and it's just warming up at the tip of that. And the answer is, well, if it was warmer then this warming now is just another example of that. And I can't tell you how many times those famous professors I mentioned have said that. And I teach a freshman, sophomore seminar in environmental literacy. And at least half the kids, when they apply, I make them do an essay. No lottery for admissions in my class. I have to punish myself by reading the essays. And the kids who say that, I don't know how to fight with my Uncle Joe. I like that. That's important. They want to come here and learn how they can argue. They want to learn how they can see things, and that's important to get people to do that. At least they want to. In any case, I use a metaphor to do everything, and my metaphor is the norovirus, because I had one 2 years ago. Anybody ever norovirus, the Norwalk cruise ship virus? Talk about diarrhea. It is... It's before the break, it's okay, right? You don't want to know. 102 Fahrenheit fever for 3 days, fighting, not going to the hospital for an IV. I was good at that. I had a bone marrow transplant. I learned how to keep myself hydrated. That was years ago. But in any case, so the bottom line is, if you want to use the logic that because it was warmer 125,000 years ago, then you have the same logic by saying, well, if all global warmings are created equal, then all human fevers are created equal. So the next time I have 102, by their logic, it must be the norovirus, right? Couldn't be respiratory, kidney, malaria, anything else, right? So that's why we do the science. We figure out cause and effect, and what caused the events back then had to do with the tilt of the Earth's orbit. You take exactly the same models are used to project the future under doubled CO2. You run them backwards by changing the sunlight distribution. Lo and behold, it makes that period warmer. They don't agree to factor of 2 or 3. There's difference from model to model, but the overall direction is there. So if anything, it's confirmatory rather than denying. And again, very tough to get in a 5-second soundbite. And the people who mentioned that it was warmer before and therefore this is natural, they forgot to tell you the sea level was 5 meters higher then, because most of Greenland and part of West Antarctica was missing. 1 to 2 degrees is enough to do it, which is part of the reason we're very worried. And when you're talking about 50% of humanity living within 2 meters of sea level, this has some urban implications. So here we are, and this is the melt in 1992. Here it was in 2002, there it was in 2005, dramatically expanding. By the way, it's increasing snowfall on the top, and I can't tell you how many people have told me that falsifies that the ice is melting. In fact, that's the theory, because if you heat the place up, you add moisture, it snows more when it's below freezing, because it's a little less below freezing. But on the margins, it melts more. So who wins? Well, that's why we have NASA, and they fly satellites, and they go around there, and the satellites are quite clear that the melt is vastly exceeding the extra snow, and you have to get quantitative. Now, can you tell? Competing explanations. School A, it's only 30 years. 30 years is the oscillation time of normal fluctuations in the North Atlantic. And you can't learn anything about an ice sheet, which is the thousands of year deal, in 30 years. So, and then the other school says, no, it's global warming, it's way too much. Well, is there any way to try to pin that down? And this is work from Connie Stefan in Colorado. The red dots are where they sank little pipes in the upper layers of the snow. They're annual snow layers. You can go back and look and see if it melted. If this was just a natural fluctuation of the system, you'd see melt layers 100 years ago, 180 years ago, things like that. Didn't see it. So it strikes me, I'm already tipping my Bayesian priors, for those of you who know what that is, over to this is global warming. And it doesn't mean there isn't an element of the other, and we haven't solved the whole thing yet, and there's still speculative components, but that's part of what goes into a risk management. Okay, let's do one more bit on the Arctic, because this is directly relevant. Did any of you see that brilliant Will column about a month ago where he said that he'd falsified global warming in the Arctic because the amount of sea ice in February hadn't changed? And he said in 20 years. He's wrong. He could have said 40. What did he forget? Well, he forgot that that's one of 3 important measures of Arctic, which is the amount of sea and ice in February. February is when it is maximum. September is when it is minimum. So if you have a lake in Minnesota that freezes in November and melts in April, and now you warm up by 5 degrees and it freezes in December and it melts in March, and it's got 3 inches of ice now and it used to have 3 feet, you could say that there's no change in the amount of ice on that lake in February. We could say that that's a deep misunderstanding and a cherry picking of data, or we could call it what it is, a lie. And that's exactly what it was, because the black is multi-year thick ice and the gray is 1-year thin ice that melts. And there's a dramatic change in February if you look at the correct statistic. And if you look in the summertime, it's last year was the first year that had both northeast and northwest passages open at the same time, and there's been a substantial trend. And again, I point this out because this problem is very difficult to get past people who like to do their thing superficially. And the reason that's so important in the context of urban health is that we have to align the stars, as I said earlier, and try to use the resources that a threat to a rich country like this or the other ones that comes from global warming. And when we negotiate that with developing countries, we have to use it to make certain that the strategies that we pick, particularly for adaptation, are also aimed at improving the base state health and other conditions of those countries. And we can use some of that money to help with basic development, which we should do with or without climate change as a threat. But as long as we've got it, it's a tie-in or a co-benefit, and that's going to be a very important component of effective strategy to use the resource availability. What did Rahm Emanuel say about the stimulus package? That a crisis is a terrible thing to waste. Anyhow, not everything is bad. Right? Good news, at the current rate of global warming, swim over there and eat him in under 5 years. Sorry, I think he's got a resource-based problem, and in any case, big fish, 90% are missing. These guys won't make 5 years, but that's... Why is there benefits? Shipping industry. Open up the Northwest Passage, save money. Now, Michael's talking later, Michael Hanneman in the back, and we'll let him explain. If you can use a cost-benefit analysis and figure out whether global warming in the Arctic is a good thing or a bad thing by figuring out how many tens of millions it's going to save you in shipping costs, it's a plus in the cost-benefit analysis. And what about oil exploration in the Arctic? And then, of course, there's oil exploration in the Arctic. We have the 6 countries around the Arctic just fighting over each other to divide up all that resource opportunity. And then we have the Inuits, and this is a statement from the Inuit Circumpolar Council, which is this a politics of oil. They're destroying our culture. So how are you going to put in the cost-benefit analysis the benefits to the shipping industry, and you're going to dollarize and discount the destruction of a 5,000-year-old culture and then call that a moral paradigm for decision-making? And that's exactly why people have to understand these issues to know how to apply them. How much time do I have? At 5. All right. That's all right. Then there's another question. Now, I'm not going to give the ecology talk, but these guys like ice. In fact, they're pretty bad without it. Aren't they cute? Anybody ever seen this iconic symbol of global warming? And if you think they're cute and you walk over and you pet it and you say, nice bear, you get, in the bicentennial, a Darwin Award. They are nasty. The reason we want them there is a value judgment. It's because they're a product of 5 million years of the coevolution of climate and life and a special adaptation. And why does one species have the right to drive them away so that we can be, if you really run the numbers on the trillions of dollars it'll cost, Michael will tell you later, it's a small fraction of the growth rate in the GDP if we grow above 1%. So you can't use the last 6 years, the last 6 months to determine your extrapolated growth rate. You want to use the last 6 years, you're looking at 4 or 5%. In which case the costs of all the mitigation and all the solar and all the extra insulation is a trivial fraction of the growth rate. You're 500% richer in 2101 with 350, 400 parts per million of CO2, or you're 500% richer in 2100 a year earlier with 900 parts per million and all these side effects. So from that perspective, keeping them here is not expensive. But when you're taking a look at the amount of money that we invest to deal with the kinds of important development issues that Alex and Trevor talked about, we've been pretty derelict with or without climate change. So why don't we use climate change, as I keep saying, as a linkage to try to get both of the problems dealt with by resources when people feel a threat. Okay, when you're an icon, you got to take some hits. You ever see this one? How did this guy from the South get across the heated pulse? This one is smoking, so yeah. Anyhow, this is what I call the victims as villains, and my favorite, this is the revenge of the polar bear. The bad news is the ice cap is melting. It's going to be almost impossible to catch seals. The good news is if we keep moving south, there's tons of fat animals called humans who can't run very fast, and this is called the map of meat. And as you notice, it's age, ethnic, and gender appropriate. They would be, and if you made a prediction as an ecologist whether the physiology of the bear is going to move it north or south in warming, you're going to predict north, but it's going to go south because it's not going to have any food. There are many other species, however, that aren't that clever. So again, how do you weigh into the mix of a cost-benefit analysis the destruction of an ecosystem? And you could try to do what many of my ecologist friends do, which is what they call ecosystem services. If you cut down the trees in the forest, you increase floods. That has a dollarized value, and I don't have any problem with that. But it's a very slippery slope. You're getting into the religion of economism, because as soon as you start playing that game, now you want to dollarize and discount. I'm not sure you want to go to the paradigm. What you want to do is have a political decision about what levels of cuts you want, We don't use cost-benefit analysis to figure out the federal budget, the fraction that goes in defense and in health and in welfare and in national parks and in housing. It's a political decision. But once you have a political decision for targets, my God, what are we going to throw money away for? Bring on those economists, bring on all their dollarizing and discounting. We want to get there as cost-effectively as we can. Plenty of room for everybody. And you have to make certain we know where we are. Okay. So it's a big canary, and this is the question I've been trying to get out of this, which is when we're talking about policy, you have to watch out for the people who want to sit there and tell you what the health benefits are for solving a health problem in a sub-Saharan slum. Are they going to dollarize the value of life at $2,000 and then pick $2 million in the North? Well, there are those who do that, and there are others who say they're just deeply immoral. And these issues will come up where academics meets the political road. And then, of course, you can throw sulfur in the stratosphere. These bears are working pretty hard to try to cool the climate down, but we haven't figured out where we're going to do geoengineering yet in the IPCC. But every time you add CO2, you're putting more carbonic acid in the oceans, and this is not controversial. This is absolutely certain within that realm. What's controversial is what does it do to coral reefs? What does it do to the bottom of the calcareous, shelled food chain, the phytoplankton? And those issues, we know that it's going to dissolve the shells. If you get down here, that's virtually certain, but what happens in the middle, how far can you go? Those are all the risk management things. Okay, so I got to wind up. So that's the bottom line. So let's get back to cities. What threatens a lot of cities is rising sea level and storm surges. Remember, the surges are more difficult. So here was, the black line was the sea surface temperature in the Atlantic. The dashed line was a measure of the power dissipation index from Kerry Emanuel at MIT. Power dissipation index means how fat the storm was and the cube of the wind speed, because that's power, right? Energy is U squared, take a derivative, power, okay. So very well correlated. But it's only 30 years. Another one of these competing explanations. School A, natural fluctuation in the North Atlantic system. School B, 5.5 degrees Celsius warmer oceans caused by humans, and therefore, of course, I'm in school C, both, and I want to know how much, and that's a tougher problem. So what they do is they take a look in all oceans, not just in the Atlantic, in the Pacific, and in the Indian, where there's also a correlation between power index and temperature, though not as good. And we're in competing explanations with at least some component of humans, and the IPCC was careful. It's, quote, more likely than not. That's more than 50%. What's the judgment of evidence in a civil trial? Preponderance. So it's a preponderance of evidence already that what's been observed is at least connected to warming, and that as we get much warmer in the future and you get out of the noise level, it's likely to intensify. That's the kind of issues, and I'll end with saying that the main kinds of problems that you have to worry about when you scale climate down, big one is sea level rise. On the other hand, it's going to be over centuries. On the other hand, it's going to last for thousands of years, so it's effectively irreversible. It will be highly heterogeneous in who is impacted. So there's immediately an ethics question on the distribution of impacts. And what we try to do to fix it, like shadow price on carbon, for example, will also be highly inequitable, because for me, it's going to reduce the quality of my Pinot Noir to have more expensive energy bill. For some poor people, it's the quality of their protein. So you have to recognize that people get hit coming and going in terms of inequity by large-scale global change when you scale it down. And the only way you can deal with that is not by saying, well, we can't increase, this is a regressive tax on poor people, let's not do it. Wrong. Don't subsidize poverty with artificially low prices of commodities like food or energy. That's historically known, I'm with the economists on this, to cause big problems. Subsidize it with the real stuff, money, resources. So now we're back to good governance, which we heard in the beginning is not the same as government. And people say, oh, you're talking about world government. I said, no, I'm not talking about world governance. We can keep the structures we have. We just have to make some agreements. It's a social contract, remember? No, they don't. But you have that argument. So we don't give them Locke, Hobbes, and Rousseau. We just basically, what I say is just imagine the carnage on the highways if if we had traffic lights and speed limits with no cops and judges. People get that, they understand a social contract. So, and even the libertarians are in favor of traffic lights and, and speed limits, and they usually will go along with licenses for doctors and pilots too. So we've already encroached on personal freedom, so we're no longer arguing principle, but where to put the line in the sand, and when you can get them past that, you can almost have an intelligent conversation about climate change. But you've got to get there first. Okay, so the bottom line then is that we have those things. In California, why is the state so on board? Because fire risk. That's one of the single most important factors here. We're a Mediterranean climate. It's long and dry. We're going to have fires at the end of the summer. If you melt the snow earlier, and there's a very good study from Tony Westerling in UC Merced, which shows that almost all the large acreage burned in the last 30 years occurred in the years of early snowmelt, not just in California, but across the West. And that's the main prediction, early snowmelt that goes along with warming. So that increases the fire risk. The main way fires kill, and this is a real urban issue, is not by killing people directly. I mean, even with the Berkeley fire, where there were tens, we're talking about many more than tens, children with asthma, adults with emphysema. Those smoke plumes are nasty. And therefore, when you're going to be increasing ozone just by warming the system up, and you're going to be adding increased fire, that has a very strong urban issue, which will require us to have adaptive strategies while we figure out how we're going to mitigate. And I think I've used up my time. So thank you very much.
A couple questions for Steve. In the back.
As loud as you can be.
Okay, in the spirit of the interdisciplinary symposium and in the context of the last presentation that highlighted rapid population growth in developing countries, how do you think that affects climate change? And that's kind of hard.
Well, since we mentioned John Holdren, he and Paul Ehrlich back in 1971, or I don't know, they probably published it in 4, in a fight with Barry Commoner about the relative role of affluence versus population, said, come on, it's everything. It's, if you want to talk about impact, it's the population size multiplied times the affluence, which you could measure in GDP or whatever you like, or the better GDP, per capita multiplied by the technology and organization it takes to do that, that is by the emissions of the technology. So population matters. At the moment, the lowest in income, 50% of the world's population are responsible for a very small fraction of the total accumulated emissions, 10% maybe. The richest 20% are responsible for 75% of it. So you'd say, aha, it's mostly consumption. On the other hand, if you project forward more than 20 to 40 years, then China, India, Indonesia, Brazil, and Mexico, never mind the other countries, they're still going to, unless they start really developing, they take over, and then they start approaching our standard of living. If you multiply that times their 4 times, 5 times higher populations, we have a planetary sustainability train wreck. So you end up with these two groups. This is very typical at international meetings like the one will be in Copenhagen, where the rich countries sort of blame the poor for bad governance, inefficiency, and overpopulation, and they blame us for monopolistic capital and obscene consumption. And of course, they're both right. And what you have to do is make a deal where the developing countries are not denied the opportunity to develop, but they don't develop using Victorian industrial technologies like sweatshops, coal burning, and internal combustion engines. And they'll say, but you're not doing it, why should we do it? You know, well, therefore we better walk the walk. So population is a piece of the story. And I even heard one Chinese at a meeting defend their one-child family as a climate strategy. Now, the truth is it wasn't, but it is. Because in essence, by keeping their potential population down as their standard of living increases, they're not multiplying at times as many people. So we really have to do everything. And we heard from Alex about unwanted births. It seems to me that, thank God, we've gotten rid of the ideologues in the American administration that were denying people even access to elementary technology that's cheap when they wanted it. And there's nothing coercive in that. And in any case, so all of these factors fit together. So population is without doubt a piece of the story, but like anything complex, It is necessary to deal with it, but not sufficient.
One more question, Wayne?
Is global warming going to increase or decrease the risk of World War III? This is really a serious question.
No, I agree with that. It's a very serious question. And in fact, I was asked in Congress a year and a half ago, oh, so you must think that climate change is the world's most important problem. I said, no, avoiding weapons of mass destruction at a large scale is the most important problem. Sustainable development for a world that we can live in without having it a fortress that's not worth living in and that destroys the species. And then I'd put climate third, but the good news is a lot of the things that you could do to deal with the climate problem, if your governance was careful and linked, could also help you with some of the other problems. And I don't think it will reduce the probability of war by having a lot of boat people floating around in Asia displaced by rising sea levels and frequent storm surges. So I think, in fact, that's what the generals meant when they said it was a threat multiplier. They were actually worried about the fact that although climate change does not make human security problems, we do that, all by our little good selves. But if we have areas of multiple shared rivers like in the Middle East or in other places, people don't like each other and all we need is a little push over the edge, it could be pretty threatening. So I actually think there are connections. And if it increases poverty or if it increases the difference, remember the impacts of climate change are generally much worse on already hot places than on cooler places, because those of you who are ecologists know that fitness for most species is an upside down curve. It has its optimal, and then if you get too cold, it drops off, and if you get too hot, it drops off. And for us, some of our plants and crops are a little to the left of the peak, so we could tolerate a degree or two more. And in most of the tropical places, it's already there or to the right of it, so therefore it gives them a more rapid decline. So you're going to end up with a situation where the rich get richer and the poor get poorer, and that is certainly not a prescription to improve the likelihood of avoiding, catastrophic conflict. So these issues link. And again, I think Obama's the first person as a national leader who's actually been articulating that. I'm very glad your former professor is sitting there and whispering in his ear this kind of stuff every day.
Thank you very much. So 3 very intriguing and challenging presentations. It's commonly understood that one of the worst things for your health is to sit in one place for 3 hours and then move to a meal. So luckily, we've built into this process a simulation, an urban simulation that involves chaos and overcrowding before you get your food. Behind me here, the magic doors, there are about 6 tables. What I'd like to suggest is that the strong amongst you volunteer, come get those tables while the men take the chairs and put them in circles. You get extra points for that. And what we'd like to do is encourage you to have lunchtime discussions that pick up on some of these themes, but in which really get you all to share what your interests are, and particularly what you are doing, what you know about, and what you would like to get involved in response, not only in response to these presentations and the challenges they put forth, but less in terms of understanding the problems, but more in terms of coming up with solutions. So again, the idea is to sit around in groups around the table, share a little bit about what you're working on, what you think is important, what we could be doing. And then around 12:10, 12:15, our colleague Wayne Getz is going to come up and try to help bring out some of those. So if there's someone at each table who could volunteer to maybe present some of the best ideas to share with the group, that would be appreciated as well. All right? So lunches are in the back. You can only get those once you've set up your tables. Go for it.